You guys are just waking up. I'll get the questions later. I have a document that goes along with this one. It's under your course materials, under handouts. It's the developmental growth chart or developmental stages chart. It has the names or the A next to it on the side, and then it's got things like gross motor skills, fine motor skills, language skills across the top of the page, and it has little boxes. And so each age has the kind of information of the different breakdowns of things that kids can do in those different categories. I designed it so that it's more of a hands-on activity. These couple chapters have a lot of memorization to them. There's a lot of developmental stuff, especially if you're new to pediatrics and haven't worked with kids a lot. This is going to be a challenging chapter for you. You might have to spend extra time studying it because it is a lot of memorization. But we have to get through these growth stages first to kind of move on to the rest of the med-surg kind of content. So if you take that chart and you break it up and you cut it up into the little squares, you can kind of scramble it up like a puzzle and then put it back together. And that's more active learning, especially for those of you that are tactile learners versus a visual learner. That's more of a tactile skill that will help with kind of memorizing those kind of categories. And I'll put this in an announcement later today, but you also have your red HASI book or the like little thin review book, HASI review book that you guys have. It also has a kind of a quick breakdown of some of these developmental stage stuffs. I think sometimes that is a little bit easier just to look at it first because it's a little more condensed than the book. The book has a lot of information in these chapters, and there's some big charts that have a lot of things that kids grow and do and change. So it can be a little overwhelming. So I think that those are kind of a couple ways to kind of break this down so it's a little bit more condensed and not as overwhelming with the content. We're going to talk about things like Piaget stages, Erikson stages of development. So if you think back to, your growth and development classes or psych class that you had before you got to nursing school, and even last semester, I know you guys touch on, I think Erikson's you go over at least once. Those are things that we're going to go over today, class. This is one of my favorite weeks, going through these health promotions through infancy to adolescence. Because I think it's just fascinating how much kids grow and change. Okay, chapter 9 is health promotion of the infant. So we're going to start here. And these are your course objectives or chapter objectives for this chapter. So developmental change that we see with our pediatric patients in this section, they grow a lot in this first year, and I'm going to touch on the basics with this. We'll get more in depth in some of their anatomical changes and some of your assessment changes again in the next few weeks as we start into the system-based. But let's talk a little bit about their growth. This is the period where they have the most amount of growth. If you think about an infant, when they come out, they are floppy, they need support, everything that they're doing is based on reflexes, they need a lot of care at that point. And by the time they hit a 1-year-old age, they're walking or at least pulling themselves up and cruising around. So there's a lot of change that happens here. So just in their proportional changes, their birth weight by the time they're 6 months of age should do what? It increases by how much? Get you guys chatting with me in the chat box here to wake you up, get you engaged. Okay, it should double by the time they're 6 months. So their birth weight should double by the time they're 6 months of age. Their birth weight by the time they're 1 year of age should do what? Destiny got it first there. Yep, it's going to triple by the time they're 1 year of age. So their birth weight triples by the time they're 1 year of age. Their length increases by about 50% by the time they're 1 year of age. So if a baby's born at about 20 inches, which is somewhat average, they should be about 30 inches by the time they're 1 year of age. That's a huge growth change, right? They go from these little tiny masses to being able to walk. Their head circumference increases by about 33%, so about 1/3. Toddlers are bobblehead dolls. They have these giant heads, these big old bellies, and they have these really kind of short, stumpy legs that they kind of wobble around on with these big heads. their head grows really, really fast in those first couple years. And then growth overall for kids in their early developmental stages, a couple things to keep in mind. One is that they have growth spurts. They don't grow in these little, like, gradual over the course of the year. They literally will have a period where they're eating more, they're sleeping more over the course of a week, and then they wake up and they're taller. So they have these physical growth spurts. They also have cognitive growth spurts when they're learning a cognitive skill. And that could be the kid that's learning to crawl or walk. They will sleep more and eat more during that time period. And a lot of times they're fear during that time period because their body is changing very, very rapidly. The other thing to keep in mind with growth is that it is head to toe. So it's cephalocaudal down. So it develops from their head to their toe. So if you think about that newborn baby that's really floppy, they don't have good head control. We have to support that head when we're holding them. So the first couple of things that start to develop are that ability to hold their head up. That 1 month old, if you lay them on their tummy and they, they pick their head up, they can kind of look around a little bit at that point. The next thing that kind of develops around 6 months of age is that ability to sit up. And so that's kind of developing down to that core. And then by the time they're about a year of age, they're up and they're either walking or cruising along furniture. And cruising kind of looks like the kid that's standing up at like the side of a table and they're holding on and they're using that table to support themselves as they're walking along. So head to toe down. They also develop from that core out to their fingertips. So as they're growing and developing, they get a lot more of those gross motor skills first, and then they develop more of those fine motor skills. So one of the things in this infancy period that starts to develop first is what we call a crude pincher grasp, and it looks like this, where they're using their whole hand to pick up something. So if they're picking up a block, they're going to pick it up with their whole hand like this. By about 9 months of age, they're using a fine pincher grasp, and they're using those forefingers to kind of pick up things. So it's great to give them things like Cheerios and other smaller objects to help them learn that skill of picking up their objects. So head to toe, core outward, and they have these massive growth spurts that they're going through as they change in this first year of development. So let's talk about their other systems. So respiratory, cardiac, those kind of things. And I'm just going to touch on some of the changes in this chapter. And there's still going to be a lot that we're going to talk about here. So think about your respiratory system. Last week we talked about things like the periodic breathing and that we need to assess that respiratory rate for 1 full minute with this age group because they have periods where they breathe faster and slower. They also have a couple things to keep in mind. Our premature babies and younger infants have a decreased amount of surfactant, which is that normal mucus that we have in our lungs. So it makes them more susceptible to things like respiratory illnesses and atelectasis and other complications because they don't have as much of that normal mucus that we should have that helps keep our lungs open, helps keep them moving easily. They also lack IgA. Babies in general have a weak immune system. They basically don't have an immune system when they're born. So they have problems fighting off illnesses, and respiratory is one of the big things, like we talked about last week. In our cardiac system, they have circulatory changes, which we'll talk more in depth about when we get into cardiac. Remember that their cardiac rhythm is also irregular in this first year. So you are doing a full minute for your cardiac assessment for your heart rate, and that it should still be sinus rhythm. So if you put them on an EKG, you're still going to see sinus rhythm, but it's going to be irregular. And those cardiac changes we'll talk more about, but their heart's in a slightly different position. Their heart, when they're born, has holes in it that have to close to function correctly. In the hemopoietic system, their blood. Think about that baby that just came out, that newborn baby. Whose red blood cells do they have circulating through their system? Okay, so they have mom's red blood cells circulating through their system, right? Because mom's body is doing all the work, right? The oxygenation, the CO2, O2 exchange, everything's being done by mom. So when baby's born, all of those things have to be taken over by baby's body. And it takes a little while for those processes to start to mature. One of them is the bone marrow being able to produce their own red blood cells. So it takes them several months to lose mom's red blood cells and start making their own and kind of have that equal balance. So around 4 or 5 months, it's pretty common to see physiologic anemia at this period, just because they've lost all of mom's red blood cells, and it takes a little while for their body processes to kind of pick that system back up. In the digestive system, so there's a lot that happens here. babies don't have teeth when they're born, right? They got these little gums, so they are only taking in formula or milk, breast milk, and they can't digest their foods like we see with older patients. They don't have the ability to break down fat, and they don't have the ability to chew things, right? So it's important that they get the right nutrition during that time period. They also have a decreased amount of hydrochloric acid, and that actually doesn't get up into regular concentrations that we see with our adult population up until about school age. So it takes a while. Their stomach is also really, really small. It's about this big. It's about the size of a cherry when they're born. And then it gets bigger. It's also completely round. So they don't have that kind of kidney bean shape as they are starting to develop. That takes a couple years before they get that kind of elongated shape to their stomach. So teeth start coming in around 6 months of age, and they should all be in by the time they're 2.5. All those baby teeth should be in by the time they're 2.5. Some kids get one at a time. Some kids get all of them all at once. And so it can be, you know, before they're 1 year of age, or sometimes it's one at a time until they're 2.5. They also don't have the ability to produce saliva when they're born. They should still have moist mucous membranes. Their mouth should still be moist, but they don't have spit. Right around 3 months of age is when we start to see this develop. And it's pretty common for parents to come in and think that their kid are cutting teeth at that period because they start drooling all over the place. They're drooly little messes. It's not because of the teeth coming in, though, at that age. It's usually because they don't know how to swallow their own spit. So that their saliva starts being produced, and they literally just don't know how to swallow it. They don't know what to do with it, so they just start drooling all over the place. So those are some of the digestive system changes. In our immune system, remember that I mentioned that they lack an immunity when they're born. They have to develop their own immune system. So they have passive immunity from mom when they're born, and that will be continued if they continue to breastfeed. So there is, a big benefit with continuing to breastfeed. And we try to encourage that for as long as possible, even if we can get mom to breastfeed for the first 6 months or the first 3 months, which is kind of the highest risk period, that helps give baby that passive immunity. Here's one of the really cool things about breast milk. So if baby gets sick with a virus, let's say baby gets rhinovirus, and mom has had this virus before, mom's body will actually sense that baby has this virus and will be able to secrete those antibodies through the breast milk so that baby gets passive immunity to help fight off that virus. How cool is that, right? Those are awesome. Thanks, Nate. Yep. So yeah, that's a really great benefit for continuing to breastfeed. So it takes a little while for that immune system to start working, and it really is not mature until they are in their adolescent years. By school age, they start to have a decent immune system, though. Their thermoregulation is also very different. They do not shiver, or younger babies do not have the ability to shiver. So they use a couple different processes to warm their bodies up if they get cold. One is a process of metabolic heat production. So they have a lot more concentration of what we call brown fat. Unfortunately, decreases as we get older because it basically burns sugar, burns glucose to warm their bodies up. And this process is important for us to remember as nurses, right? If we have that baby on the OR table for several hours that has been naked because they're on the OR table, what are they burning? They're using all of their sugar, right? And they're probably not eating at the moment. So we have to make sure that we think about either a fluid in their IV that has glucose in it, or feeding them right away, because they can be hypoglycemic pretty fast if they're cold. The other thing that they'll do if they get cold is they will become mottled. They vasoconstrict, and they get that kind of lacework pattern to their skin. Cutis marmorata, if you remember back from health assessment, it's kind of a really long, wizard-like name, right? They get that lacework kind of mottled appearance to their skin. So those are kind of ways that babies will help increase that body temperature instead of shivering like we do as adults. The renal function is also really, really immature in this first year of life. They pee frequently. They don't have the ability to concentrate their urine. So their fluid and electrolyte imbalances can be pretty significant if they are dehydrated or not taking in the right fluids. So it's something that we have to think about You'll change a diaper of a newborn baby every hour or two at that age just because they're peeing really frequently. Their specific gravity is usually pretty close to 1 to 1.01 at this age just because they can't concentrate their urine. Their kidney function doesn't really become more mature until they're at least 2.5, so it takes quite a while before that happens. And then there's senses, so, you know, our sight, touch, those kind of things. So our touch is intact when we're born. They should still be able to feel you touching from their head to their toes, but they don't quite have the ability to process those sensations yet. They don't really have the ability to understand what hot, cold, sharp, dull is yet, but they still have touch intact. Their hearing should also be intact. All babies get hearing assessments in the United States before they leave the hospital. That's something that we do across the board. So that should be intact. Their taste is also intact, but they, again, don't really know how to process the different tastes and you know what sweet, salty, those kind of things are yet. Their vision is really poor when they're born. They have about 20/40 vision when they're born, and they can't see past about here. So we can look at the camera right about, you know, a hand to a couple hands past their face. And they also really don't have the ability to recognize all of those colors. So we put all of those really nice fuzzy colors in babies' rooms, like the pinks and the blues and those kind of things. They can't distinguish those colors at this age when they're born. It takes them several years before they really get full vision. But in this first year of life, it's really like black and white, those black, white, red kind of contrasting colors that they can see. They also don't have binocularity, which is the ability to focus on one point with both of their eyes. If you get a chance to look at a newborn, look for, I'll see if I can find a video of this since you guys won't be doing newborn assessments in the hospital right now. But basically, you'll see their eyes kind of looking at different positions at the same time. They look like those little Google eyes, kind of looking at different spots at the same time because they don't have that ability to focus binocularity. By about 8 months of age is when they get depth perception and they can really start seeing more kind of details and features around them, and they can focus with both eyes. It takes them till about 3 years of age before they get 20/20 vision. So it kind of increases from that 20/40 when they're born to about 20/20 by the time they're 3. That was a lot, right? That's like this much. And like I mentioned, growth, again, is these chunks that they go through as they're developing in this first year of life. So those are some of the physical changes that kids go through. Now we're going to talk about some more of their developmental stuff. So remember I mentioned Erikson and Piaget's we're going to be going through. So Erikson is psychosocial development, and this first stage of development is trust versus mistrust. Babies need to learn to trust the world around them. And last week I talked about things like touch and caring as some of those major ways that babies develop some of the key features that they really need. They need to learn to trust the world around them, and that is by having someone respond to their needs. So if they're hungry, they get fed. If they have a diaper that needs changed, somebody changes the diaper. We know that kids that just get the minimum, they get food and warmth and shelter, but they don't get that primary kind of caring, holding, touch relationship with a primary caregiver, have trouble developing this trust relationship. And the problem that can develop is that if this trust relationship doesn't develop, they have trouble moving through every other stage of development. So this one's an important stage for really being able to be a functioning adult. So we need one caregiver, at least one primary caregiver for a child to attach to and to have that kind of bond with. And that is usually mom if there's breastfeeding. If it's a traditional, family with breastfeeding, mom is usually kind of that role. But it can be dad, it can be grandparents, it can be whoever that primary caregiver is for this child. And that's everything that you're doing, holding, touching, loving babies in this first phase of development helps develop that trust. One of the things that we can see that kids will develop mistrust is if they never experience frustration. So we have babies that maybe are never put down. They're changed before they need to be changed. They always have a bottle in their mouth, so they're never able to experience what it's like to be alone and have somebody pick them up after they've been crying, or they're hungry and somebody comes in and feeds them. So if we have too much frustration or not enough frustration, we can develop mistrust, because we need to be able to recognize, hey, this is happening, I'm frustrated because I'm hungry, and somebody comes in and responds. They need to be able to develop that skill to say, this is how this goes. I have this person in my life that's going to be able to do this for me, and they're developing that trust. All right, the next stage is Piaget. So this is cognitive development. This is Piaget, and this is sensory motor phase. So the first year of life is sensory motor. So a lot of what we see with this cognitive development in the first year is their senses and their motor functions. So the 4 stages here. The first stage is just reflexes. That neonate, that under 1 month old, has everything they're doing is basically based on reflexes at this point. And if you think back to health assessment, these are things like the rooting reflex, where you rub their cheek and they kind of turns toward that stimuli. So they're not able to cognitively recognize cause and effect at this age. Primary circular reactions happen in the 1 to 4 month period. Now they're able to start kind of making a little more connections. This is when they're able to start recognizing, hey, I'm hungry, I cry, someone will feed me. So they're able to start with those kind of basics, and cry in response is a big one at this age that they're starting to do. Secondary circular reactions are the 4 to 8 month olds. This is my personal favorite with infants. I love this age of development with infants. Right about 6 months of age, when they can kind of sit up on their own and they start interacting with you. It's a great age. So a couple of the things that I really enjoy, and these are the things that they're developing. Imitation is one of the things that you'll start to see during this phase of development. They will start imitating facial expressions. They'll start imitating sounds. This is when we start getting the gagas and the goo-goos and those kind of things. And they'll start with facial expressions as well. And last week, remember, we talked about that being a form of communication with younger kids, is they're looking at our face, they're looking at our body language. Those are things that we have to think about. The picture that I've got on the slide here with this little guy with the eyebrows, babies don't have eyebrows, so if you use a non-permanent marker, this is what the effect looks like with babies. But they will mimic those kind of facial expressions of the like surprise look, those kind of things. Play is also something that they're learning at this point, and to them, play is learning how to crawl. So it's not uncommon for kids at this age to wake up in the middle of the night and start crawling in the bed, and they think it's a game. Mom, dad comes in and they see the kid, and the kid starts giggling, and they're like, why aren't you asleep? And the kid starts crawling again. They think it's a game, but to them, it's something new, it's something novel. They're learning these new cognitive skills. Again, motor function. And then their little affects start coming out at this point, whether they're kind of the easygoing kids or a little challenging, those kind of things start coming out at this point. Their giggles. I think I mentioned to you guys last week that if you're ever having a bad day, pull up a YouTube video of a baby giggling. It's really hard to find a video of a baby giggling. All right, the last phase with this one is the coordination of secondary schemes between 8 to 12 months of age. Does anybody remember what the one main thing that Piaget defined in this developmental stage was? There's one big thing that she defined. And if you, I'll give you a hint. It has to do with objects. You guys awake today? There we go. Yes, object permanence. Good. And if you didn't remember that, it's kind of coming back to you. So let me tell you what object permanence is if you don't remember what it is. So basically, this is the ability to recognize that just because an object is out of sight, it's not gone. It just didn't disappear. And I've got a picture on the slide here. You have hidden your face and made it appear again. This pleases me. So you guys remember the game of peekaboo where you cover your face up and you're like, peekaboo, and the baby's like, oh my god, you disappeared and you reappeared again, and they're so happy by it. They start laughing. They're so entertained by it. They'll also do things at this age where they'll cover their little heads up with a blanket and they'll start giggling because they think that they can't see you, that they disappeared, that you can't see them. So the secondary scheme, this object permanence starts developing right about this 9-month period, and this ability kind of starts to disappear because now they're starting to recognize that just because it's out of sight doesn't mean that it disappeared, but it just is beginning at this point. So at 9 months of age, if you show them a ball, I'm going to use my hand so that we've got this ball here, right? You've got the ball, you show them the ball, all right, here's the ball, I'm going to cover it up, and you cover it up in front of them and ask them, where's the ball? they'll go over, they'll pick up the paper, whatever it is you covered it with, and they'll show you the ball. They knew it was there, they saw it hidden, they know it's still there. That's just starting at that 9-month period. It takes until they're about 18 months before that has fully developed. And by 18 months, with object permanence, you can ask them about the ball that, let's say, they were playing with in the room yesterday, and you can say, where's the ball you were playing with yesterday? And they'll be able to think about it, and they'll be able to hold that object in their head, thinking about it, and oh, it's in my room, and they'll go to their room. So they're able to recognize once it's hidden, it's still there. So it takes a little while. It takes about 9 months before that develops. But this starts in this first phase of development. This is really the beginning of intellectual reasoning, really kind of making those kind of connections between things that they're learning around the world around them, not just senses and motor function, but starting to have more of that higher level cognitive function. Okay, social development with this one, I mentioned the attachment piece with Erikson. So this is a major social development that babies need. They need to attach to a primary caregiver. It doesn't have to be multiple parents, as long as they have one primary caregiver that they are attached to. That is an important part of development. If we don't see that primary attachment develop, we see things like reactive attachment disorder. If you guys remember that from mental health last quarter, where they have trouble forming those attachment relationships. And this can be an adult that has trouble forming adult relationships, partnerships, because they did not have this develop in this first year of development. Other things that we see with social development, separation anxiety starts around 4 months of age. So before this point, babies can be passed off to different people, and they don't really care as long as somebody's holding them and meeting their needs. It's not so much of a problem before this point. But about 4 months of age, they start getting a little anxious when they're separated from that primary caregiver. So this is more commonly mom, especially if mom is breastfeeding. It's not uncommon for mom to do something like feed baby before bed, put baby in the crib, baby's starting to go to sleep, mom tiptoes out of the room, and baby all of a sudden is awake and crying because baby actually sensed that mom left the room. So that leads to that kind of separation anxiety. But it's whoever that primary attachment is. Stranger anxiety starts around 6 months of age, and this is the baby that before this point could be passed off again to anybody. As long as they're getting held and they're getting their needs met, it's not much of a problem. But the stranger that all of a sudden they get passed off to at this age, they'll look at that face and start crying because they don't recognize the face. So that's, again, around 6 months of age. If you guys notice, I have these little pluses here. The pluses with these kind of developmental stages, and this is one of the reasons why this is a very hard section, that there are these gray areas with child development. We're looking for kids to be close to these developmental ages. We want them, you know, if they do it a little bit faster or a little bit later, it's not that big of a deal. So we want them to be close because every kid is a little bit different with these developmental stages. And I think that's one of the really hard things to kind of get with child development that makes it a little bit more frustrating is kind of those gray areas, that there's not a hard fast rule. Now I will say on an exam, especially for HESIs and those kind of things, they will be looking for that textbook answer. So if you have kids of your own, try not to think about your kids of like when they developed some of these skills that we'll be talking about, just because that can throw you off because it may not have been right at that textbook answer. So again, the testing is usually looking for that kind of textbook answer for these kind of things. Okay, let me see. It does say, how do you get baby to be attached to both parents or just mom? So baby will naturally be attached to both parents, but if mom is doing breastfeeding or mom's the primary caregiver and is doing that like every 3 hours, remember baby's developing the trust because of those needs being met, right? So if mom's doing the needs, the feeding every 3 hours, mom is going to be that primary attachment at first. Towards the end of infancy period, you'll see babies start to attach more to that other parent that maybe isn't the primary caregiver. And if parents are equally dividing up those activities, it's not uncommon for babies to have an attachment to both parents, but they will usually have a preference for one parent over the other, especially in this first year of life. You're welcome. All right, temperament with kids. So remember I mentioned that they start developing their little personalities, their affect at this point. So we see three kind of textbook defined definitions of temperament with kids. There are three. So one's easygoing. These are the kids that do really well in most situations. They don't really need rigid routines. They can kind of bounce from activity to activity fairly easily. Then we have difficult temperament kids. These are the kids that do need routines. They do better with routines. They don't do well with change. And then we have what we call slow to warm up. And these are kind of typically what you'll hear people refer to as the shy kid. This is the kid that gets into a new situation and is kind of quiet, kind of reserved, maybe hiding behind mom's leg. And then once they kind of get used to their surroundings or they're used to the people they're with, then they'll start to come out and their personalities will come out. I admit I have one of these kids. My daughter's super, super shy. When she was younger, we would do something like go to the museum, and the people at the museum would ask her a question, like they would be presenting and teaching something, and they'd ask her a question, and she'd just be like, nothing. She would not talk to them. And I'd, come on, you can talk. Nothing would get past her. But by herself, or once she's in a new surroundings, she does not shut up. So those are kind of typically what we see with the slow to warm up kids. They're usually pretty easygoing. They don't necessarily need strict rigid routines, but they do better with kind of familiar surroundings. So let's think about nature and nurture or both. Temperament is both. It's a combination of parents, it's a combination of the environment around them, and it's a combination of just that individual child. If you think about your own development, if you have siblings at home, you're probably different than your other siblings. I have two younger sisters, and we're all very different in our temperaments and our personalities, even though we grew up in the same household. So that's kids' development kind of goes along with parents, but not always. So it's not uncommon to see a child that's easygoing because the parents are easygoing, but we also see opposites. And that can be a challenge for us as healthcare workers sometimes, because if we have an easygoing kid and we have a difficult temperament parent, or we have a very high anxious, stressed out parent, it doesn't always mesh well because the parent doesn't always understand that the kid is like, all right, mom, this is school. I don't need this strict, rigid routine. Or the opposite is true, right? The parent that maybe is easygoing and the kid that really needs the strict, rigid routine, and the parent just doesn't understand that. So it makes it hard sometimes for them to mesh or help each other cope in healthcare settings. All right, concerns with growth and development. So each of these chapters have a little section that they call concerns with growth and development. And these are things that parents are concerned about, that we often are educators or help give parents guidance through these challenging things. So limit setting and discipline. Do you guys think that we discipline or limit set with infants? Do we discipline an infant? What do you think? Okay, got a lot of no's. Does anybody think yes? Destiny. Okay, do you have an example, Destiny? In what aspect? Okay, Emily asked in what aspect. So let's talk about it. Not picking up right away when crying, self-soothing. Yeah, those are good examples. Okay, so let's talk about this a little bit more. So limit setting and discipline. So if you have that infant that is crawling or learning to walk and they're heading towards the stairs and you say, no, don't go towards the stairs. That's limit setting, right? That's disciplining. It's the basics of it at this point. We really do actually limit set and discipline kids. And most of the stuff that we're doing around at this age is safety and helping them kind of learn the environment around them. Babies pick something up off the floor. Where does it go? In their mouth. So an adult around them that says, hey, don't put that in your mouth, that is limit setting. And we really do start it in this infancy period. If we don't actually start addressing it in the infancy period, it can be even more challenging with that toddler that's just kind of been left to go about their own. And remember, there's a big difference between that newborn and the 12-month-old in terms of cognitive and physical abilities. So it depends on the age and kind of what's going on. So we have these normal things that we kind of limit set, but our cultures also define what that actually means. It is socially acceptable to spank in some parts of the United States. We do see it a lot more frequently in the Southeast. Colorado, generally, we don't use spanking as an acceptable form of punishment for kids. So we want to go back to those cultural norms. We want to try to work with the family to kind of figure out a way to help them cope and deal with limit setting and disciplining their children. Generally, the recommendations nowadays are things like timeouts for kids. And that 12-month-old, generally what we recommend is 1 minute for every minute of age. So if they're 12 months of age, they're under that kind of 1 year period, then it's 1 minute. It's a short timeout, kind of a separation, quiet time. If they're 4 years of age, 4 minutes of timeout is kind of the general rule on that. So reassuring that kids will start to push those boundaries, that it is normal to start having to set those limits for children and give them some guidance with that. All right, thumb sucking and use of fire. Either one is fine. There's research, there's evidence-based research on both sides of this argument that thumb sucking is better than the pacifier, that the pacifier is better than the thumb sucking. It does not really matter for kids which one they use, as long as they have some form of oral stimulation, because kids put things in their mouth. It's one of the ways they're learning about the world around them. So they need that oral exploration. They need that sucking, they need that oral exploration. So kids will generally kind of pick a preference. My thought on this is that the pacifier is better, just because the pacifier can be thrown away, but either one is fine. And some kids actually don't use the thumb or the pacifier. Some kids will use a different finger. My daughter used her lovey, like her little square blankie, like her attachment item. She chewed and sucked on the side of that. So she didn't actually prefer one or the other. Most kids will kind of start to get rid of this behavior around 3 to 4 years of age. If they haven't lost it by that point, it's really not an issue until they're hitting 5 or 6. That's when we really want to start getting rid of the thumb or the pacifier. When those adult teeth start to come in, they lose their baby teeth, and then adult teeth start to come in. That's when we really start to say, okay, we got to stop this behavior. But most kids will kind of gradually drop off as they start to lose that oral exploration as they get older. All right, teething. So teething, I mentioned 6 months to 2.5 years. Some kids get them all at once, some kids get them one at a time. If you think about these tiny little sharp objects poking through your gums, kids can be fussy with them. It's not always comfortable. Some kids do just fine, some kids are fussy with them. So what do you guys think? What kind of things have you used, if you have kids of your own, or you've heard of other people using to help deal with teething? Cold washcloth, or an ice washcloth that's been in the freezer. Yep, so it's nice and cold and soothes them. Those ice gummy rings. And we do kind of recommend that those gummy rings go in the fridge versus the freezer, just because if they're too cold, they can burn the gums. So that's a better choice with those. Teething necklaces. Okay, let's talk about the teething necklaces. So are you talking about the amber necklaces? Let's see who said that one. Scroll up. Emily. Yeah, I think so. Okay. So the amber necklaces. So there are, and if you're not familiar with the amber necklaces, they're these bracelet or necklaces that are basically made out of amber stones. They are tight, more like a choker around the neck. And the belief pattern behind these are that the amber has properties that will help calm and soothe and relieve pain. There are no evidence-based research studies that show that this is true. That being said, this is a very popular trend with parents right now, and we see a lot of parents that use these amber necklaces. The American Academy of Pediatrics does not recommend their use, and the reason for that is that they are a choking hazard. There have been several children that have died while wearing these necklaces. So if you have a parent that is choosing to use them, we want to make sure that we're giving them the safety points about this, that it's not generally recommended, but if you are going to use it, these are things that we want you to think about. One, it should be a properly made necklace so that the beads are sewn individually. It's not one strand that if it breaks, all of these little choking hazards are free. The other thing is that they should not be put to sleep with that necklace on. Because it's worn tight around the neck, it should not be put on while they're sleeping. They can wear it while they're awake and alert, but not while they're sleeping. And then the other thing is that some of them have clasps that'll kind of pop open if they have pressure put on them, so that they'll pop open. So that's a better made necklace than one that has like a twist clip or something like that. Again, they're a safety hazard, but we do see a lot of parents using them, so giving them those safety tips. Okay, rubbery ones. Yeah, so there's also rubbery teething necklaces that are made of silicone nowadays, and they have like teething rings or teething necklaces. Those are fine. Don't have a problem with those. Again, kids shouldn't be put to sleep with a necklace on, but those bracelets are fine. Like, oh yeah, the one that mom wears. Yeah, those are usually the silicone made ones. There's also a version of those that is a like handheld silicone chew toy, a teething ring that has a steel plate on it and still stays cold at room temperature. So those are firm and they're cold. So those are helpful for kids. All right, I'm gonna go back through some of these. You guys were throwing them at me pretty fast. Let's see. Oragel. Oragel is good. We have a baby one. There is also things like Highland's teething tabs, which are over-the-counter medications that you put on the gums to numb them up. Appropriate use, how often to use them is important teaching points on those. I used a homeopathic version with my kid that is a clove oil based one, so it doesn't have medications in it, and that works as well because it helps numb up the gums. Gave my dog frozen baby carrots. Cindy, I mean, same concepts. Dogs tease too. So with kids, the firmness of something to chew on is helpful. We have these little mesh pouches now for kids in the US that you can put like a frozen piece of fruit or something like that in the mesh pouch, and they can gnaw on it, and that helps with cold and the firmness. Whiskey kidding. Melissa, you know, it's definitely something that we see. So it has been around for many generations. Rubbing a little bit of whiskey on the gums. As a healthcare provider, I'm not going to recommend that to a parent, but it is something that we see used sometimes. And I see medicine, yeah, some good old-fashioned Motrin or Tylenol works. It's definitely something that if they're that fussy and uncomfortable and they're not sleeping, give them a dose of Motrin, give them a dose of Tylenol. See, Sophie the giraffe toy. Those, you guys might not know who Sophie is if you don't have kids. It's basically this little giraffe thing that's about this big. It's plastic, kind of squishy. Kids love gnawing on it. Frozen bananas in the mesh pouch. Kids love those. Awesome. Good job, guys. So there's lots of options to help parents deal with this teething. And again, it can be a really long period that kids are going through that and dealing with that. Thanks for the link, Sydney. That's great. If you guys see that link there, you can click on it and see what it looks like. That's a popular one. Okay, so those are concerns with normal growth and development in this infancy period. Nutrition with infants. Breast milk is our first recommendation. Like I mentioned, there's reasons that it is a little bit better than formula, but if mom can't breastfeed or chooses not to breastfeed or mom's not in the picture, formula is absolutely fine. We want to make sure that baby is getting proper nutrition, and either one is fine. If mom is breastfeeding, if baby's breastfeeding, we do recommend vitamin D supplements. That's important for bone growth. Most women in America are vitamin D deficient, which means their breast milk is going to be vitamin D deficient. So we give babies a supplement to help with that. It's just a little liquid dropper that they get daily. There is no additional need for other fluids in the first 4 to 6 months of age. I'm going to repeat this twice. Do not give an infant under 4 months water. Do not give an infant under 4 months water. Remember those kidneys that I mentioned being immature and they can't concentrate their urine? You will cause significant electrolyte imbalances on that child if you give them just water. They have to have electrolytes and they have to be able to keep a really tight control of that fluid balance. So if they are not taking formula or some sort of breast milk, then it has to be Pedialyte of some sort. And we do see this occasionally in the healthcare setting. I've had parents that have come in with a kid that had some vomiting or diarrhea, and they were giving water, which is what we do as an adult. If we're dehydrated, we drink water. But for an infant under 4 months, because those kidneys are so immature, they cannot tolerate that. So we have to make sure it's an electrolyte balanced formula or solution. And Pedialyte is our go-to choice in the US. Are there breast milk donors for women who can't breastfeed? Yes, there are. Rosemary, there are breast milk donors. They are somewhat expensive for continued purchasing of it. There are under the table ones too, where some moms exchange. There's risk with that of things like HIV and other diseases that can be passed on through breast milk. But that is sometimes a use. Yep. Absolutely. And we use that with like premature babies in the hospital, or sometimes a mom that's breast milk doesn't come in the first couple days in the hospital. We use that as an option for the breast milk. Yes, if it's used in the hospital and it's through the hospital breast bank, it is checked. And that's why it's kind of expensive. Like if moms are continuing to buy it, it's expensive that they're buying it from a breast milk bank because it gets tested and they have to prove that each sample is safe. Yep. Okay. No honey in the first year of life. There's a risk in honey in that first year of life. For us as adults, usually it's not an issue, but for an infant, it can cause significant illness. So no honey in the first year of life. Solid food starting at 6 months of age. And there's a lot of research that shows about 50 to 60% of kids have had cookies and cakes and sweets in this first year of life. There's absolutely no reason for them to get those sweet foods at this point. They really don't know what they taste like yet, and it's calories for kids. It kind of sets them up for tasting sweets. So really we want to try to focus on things like their fruits and veggies, and then starting with their meats. So general guidelines on this, current general guidelines, are a little bit different than what your textbook has. That we start with fruits and veggies, and we start with one food at a time for about 4 to 7 days. And the reason for that is that we're looking for food allergies. So if they get one food and they all of a sudden get some diarrhea or a skin rash, then we can kind of identify that it's this new food that we just started that they're reacting to. If you're doing a back-to-back days, then it's too hard to tell if it's the new food or what it is that may have caused that rash. So one food at a time, generally starting with the fruits and veggies, and then meats usually around 9 months of age. It's kind of the general guidelines for that. Finger foods around 9 months of age, like I mentioned, that fine pincher grasp is developing at that point, so it's great to help give them something to pick up and help develop that fine motor skill, as well as the independence of being able to feed themselves. And we'll talk about that more with the toddlers next. And then we want to start weaning them from a bottle or the breast to a cup at about 1 year of age. Kids can actually learn how to drink out of a cup at a much younger age than that. I'll tell you, kids overseas in developing countries that don't have bottles, they learn to drink out of cups as early as 6 months of age. Now they're messy with it spills, but they can do it. We have these nice fancy sippy cups in the States that don't spill, and kids can suck out of them. They don't have to have something that they have to suck out of. They can actually learn to use a cup where they tip it into their mouth. They're just a little messier with it. But we're going to start that around 1 year of age. All right, sleep at this age. So the first 3 to 4 months, they're sleeping 9 to 11 hours a night. It is not solid sleep at this age, and it shouldn't be solid sleep at this age. They need to eat every 3 to 4 hours overnight for that rapid growth that they're having. So we want them to wake up and feed and sleep and feed and sleep. So that 9 to 11 hour period, they basically wake up, feed, sleep, wake up, feed, sleep. The total sleep during the day is about 15 hours. So daytime hours, they should be having periods where they're more awake and alert and they're playful and interactive, and then they'll take up. So total 15 hours. And then things to think about with sleep safety is the ABCs of safe sleep. So alone, on their back, in a crib, or their own separate sleep space. So alone means nothing else in the crib. We don't want blankets or stuffed animals or those kind of things. They don't need a pillow. Alone on their back in a crib or that safe sleep space. If parents are choosing to co-sleep, and that is something that we see, safety teaching for this is that if they are co-sleeping, the baby should have their own kind of separate sleep space in the bed. And that could be something like a baby box. If I was on campus, I bring it into class and show you guys. It's literally a cardboard box that we give parents that they can put baby into. I made my own when my daughter was born. We used an Amazon box and chopped off the top and turned the bed between us. There's also like bassinets that go on the side that baby can also sleep in. Yeah, the DockATots, which actually were pulled off the market recently for safety issues because there was a baby that got like stuck between the side of one. But there are a lot of different like bassinets that can go right next to the bed or in the bed that is safer. You know what our grandparents used? Dresser drawers, like literally old school dresser drawers. It's the same concept by putting them in that little box. Let's see, question. Are crib bumpers bad for suffocation? Yes, they are. So there are crib bumpers like that. Basically, it's like putting a blanket next to baby. So if they accidentally roll over onto it and their face gets stuck next to it, they can suffocate. And there have been a few cases of that. That's why we don't recommend them. There is one version that has been tested and it's been shown safer. It has holes in it. It has like a mesh kind of hole in the middle of it and like a frame around it. That one's a little bit safer than just like the cloth ones. Can twins sleep in the same crib together? Yes, and we do actually recommend that twins sleep in the same crib together. We want to make sure that we're still following those same kind of safety guidelines, but because they are used to it, it is something that's encouraged. Yep. Yeah, good questions, guys. Okay, dental health at this age, cleaning of the gums and the teeth, really with just a washcloth or a baby toothbrush. The toothbrushes are really fine, soft bristles, and water is just fine. Once their teeth start coming in, we can start using baby toothpaste or like kids' toothpaste. We should not be using fluoride toothpaste until they're at least 2 years of age. And the reason for that is that they will swallow the toothpaste and it can permanently stay in their adult teeth brown if they're swallowing too much fluoride. First dental visit, once their teeth start coming in, at a minimum that 12 months of age, they get their first dental visit. And then it's basically like brushing their teeth, looking at their gums to make sure they're healthy. They don't do x-rays, they don't do teeth cleanings at that age yet, just to make sure everything's going okay. Let's see. Emily, you can just roll over and feed in the middle of the night without having to get up. Yeah, the DockATot, is that what you're asking to? Or for co-sleeping? Yep. Oh yeah, there's a question. Yeah, what's the benefit of co-sleeping? So the rolling over, just feeding, and there is some research that shows that kids sleep better next to the parents, that helps regulate body temperature and breathing patterns. But there's also a lot of research that shows that kids are safer in their own safe space. There's a risk of SIDS, that sudden infant death syndrome, if they're in a bed with blankets and adults sleeping next to them. So it is recommended that they don't co-sleep, but we see a lot of families that do it nowadays. Yeah, I'd be scared to roll over too. That's why we didn't do it. But I mean, as a parent myself, I'll admit there were days that I got her up after working nights and got her up and fed her in the bed and then sleep with both of us in the bed. So we just want to make sure that we're trying to teach parents the safest way to do it. I missed the first dental visit age. Can you repeat that? Yeah, sure. So first dental visit, when their teeth start coming in, at a minimum that 12-month of age, after they've hit the 12 months, just getting a checkup. And that's just looking at their gums and their teeth. 12 months of age. Okay, I'm going to give you guys a break before we finish this chapter. We're almost done with it. So let's take 10 minutes. So it's 9:57. I'll give you 10 minutes. We'll come back at 10:07. What are you doing? Come here. If you're gonna come in here, say hi.
I thought the remote was my breakfast cracker.
Oh, you're silly. And the kids on today. You say hi. Show your teeth. Oh no. Sorry. Show your teeth. Oh, sorry, kid. I'm poking her in the eye. Okay. School age teeth. She's missing the front teeth. Alright, we're gonna get started with class. Go on. Go on. Hey. Remember the rules. Come on. I will be out afterwards. Here, take the remote. Several more hours. Go on. She is 6. How many more minutes? A long time. You don't know. 180. Bye. Oh my gosh. Heather, your twins are the same age. That's great. It's a fun age. Honestly, I've been enjoying having her home for the most part. Twin nieces that age. Yes, they talk a ton at this age. Yes, they need a lot more attention, especially when there's only one of them. She's my only one. All right, so let's keep moving on with our infants. Injury prevention with our infants. A lot of this is going to be around things that are exploration and that risk of suffocation, like we talked about last week. So aspiration of foreign objects and suffocation. So they will put everything in their mouth, and it's a choking hazard as well as an aspiration risk. I had a baby one time that came in that was like 8 months old that we couldn't figure out what was going on, and we finally figured out it was an aspiration pneumonia, and we did a bronch and found a rosebud thorn. And mom's comment was, well, we don't have any roses around our house. Where would she have gotten a rosebud thorn? Kids will put random stuff in their mouth. So we would just want to make sure that parents recognize that they need to pick up anything around the house that may be put into the mouth that's too small and is a choking hazard. Motor vehicle injuries at this age should be rear-facing car seat only. No other exception with this age, rear-facing car seat only. Falls at this age are a lot of times related to parents. Things like putting them up on a changing table or a bed or a couch, and they don't think they can roll over yet, and somehow they wiggle themselves off and they fall. Or the car seat where the baby's not strapped in the car seat and they set the car seat up onto a table and that falls over. So that's your infants. The older baby that's the 12 months of age and is starting to walk, then they might be falling themselves at that point. But usually it's kind of related to other things, falling off the couch, rolling off the couch, those kind of things. Poisoning's not as much of a risk at this age, but again, they put everything into their mouth. Burns, a risk factor. And then drownings, like we talked about last week. Babies at this age should always be supervised near water. Even if they can sit up, they should always be supervised around water at this age. All right, family-centered care. So these little boxes in your book that have this nice little kind of overview of guidance during these years, that's on page 328. And then toy suggestions for this age group, mobiles, rattles, squeaky toys, like things that they can grab and hold, like blocks and balls, especially as they're learning those fine motor and gross motor skills. Soft picture books that have different texture and colors and sensations on them for them to start learning and recognizing. Activity boxes are the ones where you have like a ball or a box that has the star shape and the square shape and the triangle shape, and they try to put the different blocks that have those sizes and shapes into the holes. So those are all great activities at this age. Latasha is a breastfed infant being seen at the clinic for her 6-month exam. Her mother tells the nurse that Latasha recently began to suck her thumb, which of the following interventions is the best nursing intervention. Recommend that the mother substitute a pacifier for the child's thumb. Assess Latasha for signs of sensory deprivation. Reassure the mother that this is normal development, or suggest that the mother breastfeed Latasha more often to satisfy sucking needs. C is right on this one. Now, if mom was telling us there were other signs that we were maybe concerned that baby's not getting enough food, or baby's showing us things like they're fussy and maybe chewing on their hand more, or things like where they're like trying to grab at a bottle, those kind of things, maybe breastfeeding more often is the issue. But for the most part, again, they are normal to start kind of developing that sucking the thumb. All right, our toddlers. So moving on to chapter 11. So our objectives for this chapter: your growth and development for this stage. The toddlers, again, are the 1 to 3 year olds, so 12 months to 36 months. And this time's referred to as the terrible twos, because those 2-year-olds are very, very, very ornery. They get temper tantrums, and they are very challenging to work with at this age. And it's a normal thing. It's actually a good thing for them to be throwing temper tantrums, because it means that they're recognizing the world, they're testing those boundaries, they're exploring things, and that's how they figure out how to be adults. They need to have developed that trust and guidance from a primary caregiver, the parents, in that first developmental stage, in that trust phase, to be able to move through the toddler years effectively. If they don't have that trust developed, then they don't feel as safe to explore their surroundings and start to develop more of those independent skills in the toddler years. Biodevelopment for this age group, how they're physically changing: about 4 to 6 pounds of weight gain a year. Their weight by the time they're 2.5 from their birth weight should have done what? So it doubled, it tripled. So by the time they're 2.5, yes, it quadruples by the time they're 2.5. So it takes much longer before we see that jump again, right? 6 months, a year, and now it takes until they're 2.5 before we see another increase of that birth weight. So quadruples by 2.5. Their height increases by about 3 inches per year. And again, this is all still these chunks of growth spurts that they're having, that they literally can grow 1/4 of an inch, 1/2 an inch in a couple week period. And then they don't grow, and then they grow. Their adult height, and here's a really interesting fact about kids at this age. If you take their 2 or 2.5-year-old height around that period and multiply it by 2, that gives you their adult height. I know that sounds crazy and it doesn't sound like it makes sense, but it actually does work for most kids. If you take their 2-year-old height and multiply by 2, you will get their adult height. Unfortunately, my daughter's probably going to be short, but we will see how it goes. But that's a pretty accurate measurement. The other things to think about with head growth and those kind of things are those fontanelles. So if you think back to assessment, you talked about these, hopefully. So we have these soft spots on our heads when we're babies. We have a posterior fontanelle back here that closes in the infancy period. It closes between 2 to 4 months of age. The anterior fontanelle is this front one here, and that closes in this toddler years. Does anybody remember when that anterior fontanelle closes? Perfect, Destiny, you got it first. Yep, 18 months. So 12 to 18 months is when that anterior fontanelle should be closing. So the soft spot fontanelle closes between 12 to 18 months. And again, these issues, right? If that baby comes in at 18 months of age and that fontanelle is still slightly open, it's right at that 18 months. I'm not going to start panicking or freaking out at that point, but I'm definitely going to keep a close eye on it. I would definitely have them come back in a few weeks to reassess it to see if it closes around that 18-month period. And there's reasons that it sometimes stays open. Sometimes it's congenital issues. Sometimes it's hormones. Sometimes it's things like hydrocephaly. So it's an important part of our assessment. We're also making sure that we're assessing that fontanelle to make sure it's flat and soft. And something that parents sometimes freak out about is that the fontanelle moves, it will pulsate. And I've literally had parents come in through the emergency room with the chief complaint of this weird moving thing on their head, because it pulsates. You can see it literally pulsate. And if they're crying, it kind of bulges out, but it should be flat and soft normally. What do we do if it doesn't close? We'll do a full assessment. We'll figure out why it's not closing. If it's something like hydrocephaly, we'd have to fix the underlying issue. Gigantism is also something that would be a cause, and then we would have to fix the hormone levels. We don't necessarily put like a bone plate or anything in there, but we want to figure out what the underlying issue is of why it hasn't closed. Good question. Okay, maturation of systems, so those other physiologic systems. So most of their systems are starting to mature and they're starting to tolerate some stressors now. So in their neural system, one of the things that we see an increase of is their brain mass. They have about 75% of their overall brain mass by the time they're 2. So big heads. Remember their heads, bobblehead dolls. This 2-year-old stage, the toddlers are bobblehead dolls. Big heads. The other thing that also develops are those myelin sheath coverings. So when we're born, we don't have myelin coverings over all of our nervous system, down our spinal column. So it takes until we are 2 before all of our spinal column is covered by those myelin sheaths. By 2 years of age, it's all the way down to the base of the spinal column, and they can now start to control their sphincter, so they can start to be toilet trained by that age because they have full control. Head, eyes, ears, nose, and throat. So their ears, the eustachian tubes on their ears. Remember those eustachian tubes connect our sinuses and our ear canals? They are flat on children up until about 3 years of age. So eustachian tubes, they're flat, they connect. So if they get a cold or anything where they've got all this congestion, it sits in there and it'll go straight to their ears, and they can get ear infections easily. For us as adults, it angles down, so it'll drain better, so we don't get those infections. The other thing that we see with the throat stuff is their tonsils are enlarged. Their tonsils and their adenoids are enlarged. It is a normal assessment for a tonsil assessment in a toddler to see a +2 to +3 tonsil assessment. Remember, with adults, it should be +1. Or 0. So that's a normal thing. Their tonsils are enlarged. So if they get a cold, they get enlarged tonsils, they get a little bit of swelling in there, they can get airway compromise. And we'll go way into more depth about this in respiratory system. Their eyes is slowly developing. Remember I said by the time they're 3, they should have 20/20 vision at this point. And if normally when we have clinicals for you guys, some of you guys are doing school assessments where you're doing vision and hearing screens in our kindergarten population, because that's the age that we typically kind of start to do those early assessments. If they're starting to have vision problems, that's when we'll start to see them. Digestive system. So 2.5 is when I said they should have all of their baby teeth. They have a fairly mature stomach by the time they're 2, so that kidney shape. They are digesting things. They can digest fat at this point. They still have a decreased amount of hydrochloric acid until about school age. Their spit, their saliva, all those things are kind of working effectively. Their defense, their immune system is now starting to work. It is now starting to have the ability to do phagocytosis and develop antibodies. And for that reason, they get sick all the time at this age. If they get exposed to a cold, they're going to get sick because they don't have antibodies to it yet. Babies at this age get very high fevers when they get sick, and they get sick very recurrently. And that is actually a good thing. It means their immune system is responding and developing those antibodies so that when they are older, they don't get sick all the time. They will get a fever with a cold at that age. Normal to have a fever with a cold at that age. For us as adults, it's not normal for us to have a fever with a cold, but it's because our immune system developed it when we were younger. So it takes time for that to develop. And then our neurobehavioral organization really starts to get better at this age. So this is things like our sleep-wake cycle. Kids by this age can sleep through the night. So they should be able to have those normal sleep-wake cycles. And by 3 years of age, they have a normal adult sleep-wake cycle. They will sleep through the night and have those normal kind of REM, deep sleep cycles. But they have to develop that self-soothing and those other skills as infants moving in towards this period to be able to do that. The other thing that we start to see increase is their communication skills. A 3-year-old has a decent amount of vocabulary. The 1-year-old can say one word. That's it, usually at 1 year of age. They're usually saying their first word at that point. My daughter's first word was cat. So they can say one word, and then it is really limited in those first couple of years, and then all of a sudden at 3 they start to talk more, and then it really gradually increases from there. They don't cry as much because they can communicate more. Psychosocial development, Erikson's. So this is autonomy versus shame and doubt. They think they are autonomous at this age, right? The toddler, the 2-year-old wants to be independent, and they think they're independent at this age. They like to see things like, I can do this myself. They really will get ornery when they aren't given those opportunities. So we want to help them develop that independence and that autonomy. And that's with things like feeding themselves and dressing themselves. Those are two major skills that kids are learning at this age. Now, the 1-year-old will start to be able to undress themselves, and they can effectively undress themselves when they get to this age, and they love to be naked at this age. The 3-year-old should be able to dress themselves. It's not always correct. Shoes are sometimes on the wrong feet, the shirt's on backwards, the pants are on backwards, but they can physically do it themselves. The toddler that's trying to feed themselves, the 12-month-old does not have a great ability to like get the food from the plate to their mouth. One of the skills that we want them to learn is the ability to use a spoon. So getting that spoon from the plate to their mouth without doing this and dumping it all over themselves is hard. It takes time. By the time they're 18 months, they should have the ability to get that spoon from the plate to their mouth and keep the food on the spoon. So 18 months is when we see spoon use. How do they get to that point? Well, they got to make a mess. They have to get messy. They have to learn to feed themselves. They have to dump it on their lap. They will dump it on the floor. So parents have to support that skill by letting them make a mess. And the parents that are saying things like, well, you're no good at this, you make a mess every time, it takes too long, are going to put them into that shame and doubt category. Also, if they're being overprotective and never letting them do it themselves, like, oh, I can do this for you, you can't do it yet, I can do it for you, they're not letting them develop those skills independently. So again, shame and doubt. So they have to let their child make a mess. They have to, suck up to the fact that they're going to have to give them a bath afterwards or whatever it is. The clothing themselves is also the same thing. If they're getting over-criticized and they're not allowed to practice dressing themselves, then they're going to feel that shame and doubt. Parents have to give their children more time. So if we have a parent that's 5 minutes before they have to be at the door every time is getting the kid up and trying to get them dressed, and the toddler's just wanting to do it themselves, they're going to put them into that shame and doubt. So they have to kind of allow more time, more opportunity to let them practice and get it wrong. And that's okay. Ritualization is an important thing that we want to think about with this age group. It's very important that they have a sense of security so that they can explore those new cognitive skills, those new physical skills that they're learning. So we want them to have sometimes this strict kind of rigid routine to help them with that sense of security. And not every kid needs a really strict routine, but most of them need at least some structure to their day to feel more safe to explore. And that could be something like meal times are at the same times, or nap times are at the same times, and then bedtime we have this kind of routine set. And it can also be things like the same sippy cup at mealtime, so that they have the sippy cup, they know that's okay, so that they can practice some of those other skills like use spoon. As a nurse in the hospital, this is really important to think about, because if they are used to using that pink sippy cup at home, we want that pink sippy cup in the hospital, so they have that sense of security, and we can help provide that ritual while they're in the hospital. We also think about the schedule. If they're used to taking a nap at a certain time and used to eating a meal at a certain time and bedtimes at a certain time, we need to help adapt that for this young child to help provide that sense of security so that they aren't as overstressed by the hospitalization experience. And then these concepts with Freud, if you guys think back to psych development, id, ego, superego, which one of these do you think the toddler is in? Id, ego, or superego? It's ego. It's me, 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 me. Everything they do and say is me at this point, so it's ego at this age. All right, cognitive development with Piaget, the first part of this developmental stage up to 24 months, the 2 years of age, is sensory motor still. They're still learning those senses and motor functions, but they're now starting to make more mental combinations. So what I the example with this one of like these tertiary circular reactions and inventions of new means and combinations. Basically, kind of what that means is they're able to start thinking about more depth and detail to their thought process. So something like that separation anxiety that we talked about, and they're freaking, mom leaves the house every day. Every day they're freaking out. Mom leaves, they're freaking out. By this age, they will start to have the ability to recognize that, okay, wait, mom went to work yesterday, she came back yesterday afternoon, she's done this every day this week. Okay, she leaves this morning, she's gonna come back today. They're now able to start recognizing that and making those connections of like, all right, this is something that happens on a regular basis. Or those routines, they start to recognize those routines and starting to make those kind of combinations with things. They do cognitive development with a lot of things like imitation and mimicry at this point. And a lot of times this is stuff with domestic mimicry, with mimicking stuff that's being done in the house. And we do typically see this with like the little girl mimicking mom, the little boy mimicking dad. We do see the same behaviors in children with same-sex parents or single parents. They will pick either the parent that they self-identify with or those same behaviors. Even if it's an opposite sex parent, they will pick whatever parent they've kind of attached to. They will do things like pretending to cook and pretending to clean. Dyson makes a vacuum that actually vacuums now, because a kid's version of a Dyson, because kids love doing those activities. They love to help clean and pretend. So it's great for kids at that house. That's how playing house got started. Yeah, absolutely. Yep, this is the basics of playing house. At this age, though, they don't really interact with each other to play house. It's when they're a little bit older. Awareness of casual relationships between two events, that problem solving operations, like I mentioned, like they understand that mom's leaving, mom comes back, that kind of concept. And they're now starting to learn spatial relationships, so hot, cold, big, small, those kind of concepts are starting to be learned at this age. Second part of Piaget with the toddlers is the 2 to 4 year olds. So it starts in the toddlers and kind of continues on to those preschoolers. This is the pre-conceptual phase of development. So this is the transition between these self-satisfying behaviors and starting to understand other relationships. But for the toddler at the beginning of this phase, they're really still doing everything for the me phase. Egocentricity is important. They now start to have an increased use of language. Again, that 3-year-old can have a decent language ability. They can start to have basic sentences now and follow commands. The 1-year-old's still working on it. Again, one word at one-year-old of age. The 2-year-old's favorite word is no. Remember we talked about the 2-year-old's favorite word being no last week? The 3-year-old's favorite word is why. And they will drive you nuts with this. If you have not been around a 3-year-old before during this phase of development, it will get you to the point where you remember why your parents told you at some point, because I said so. This is why. Because they'll come up and they'll ask you a question like, why is the sky blue? And you'll give them an answer. And they're like, well, why is that? And you give them an answer. Well, why is that? And you give them an answer. Well, why? And they will literally keep going down this train of thought until you finally are like, I'm done because I said so. Because that's how they're figuring out the world. It's kind of this pre-logical thought process of just like cause and effect, give me an answer. There's a question, I need an answer kind of thing. Body image and sexuality starts to come up at this age, so we want to start using proper body terminology. We don't really, especially as healthcare workers, we do not want to call body parts by different names than what they are anatomically. It is okay to use the word vagina and penis with this age group. Teaching them that it's probably not great to go around their preschool and run around and say that is also important, but we do want to use proper body terminology at this point. And we want to stay away from negativity. We want to stay away from using things like fat or skinny, because they are starting to pick up on that terminology. I mentioned that my daughter's shy. She heard me respond to somebody at the museum that was trying to talk to her and was like, she's shy, she's not going to talk to you. And then eventually she got to the point where she was like, oh, I'm shy, I'm not going to say anything. So they pick up on that. Even if they're not talking back yet, they are hearing those words. They do recognize gender differences around 2 years of age, so the male-female anatomy, and they do start to touch themselves. And this is normal exploration of their bodies. It's not for sexual pleasure at this point. It's really just for figuring out how their bodies work. And then again, those gender roles and identities come from things like playing house that we see. Yes, they are little sponges. They can't necessarily verbalize it, but they will hear all of that stuff and remember it. Okay, social development at this age. The major task that they need is actually separation from that person that they now attach to. So remember, in infancy, they wanted to attach, they needed to attach. Now we want them to separate. We want them to figure out that they are their own separate person from the person they attach to, from that mom or dad person in their life. That mom or dad is a separate entity. They have now developed object permanence, so at 18 age, object permanence. They can tolerate frustrations. They have diminished stranger danger at this point now. They don't usually have a problem being separated or going up to strangers. We need to teach stranger danger at this age because of that. And then it's also important for them to have a transitional or security object at this age. And that's usually something like a little blovey or stuffed animal that they have as kind of that attachment piece. And if they have that, they feel more secure to explore some of those new things that they're learning about the world around them. Really important as a healthcare provider, if you have a child this age, like the preschool, toddler age, they need that security object to decrease anxiety and stressors when they're in new environments. So we want that to be with them while they're in the hospital. My advice to parents on this one is that they have 2 security objects or blovies or blankies or whatever it is that the kid is attached to, because if one gets lost, like they leave it at the park or whatever, that second one is at home for them to attach to. Yep, you need the backup. I had 3 when my daughter was this age, and she did have one that was her favorite, but if that one wasn't around, like it was washed, she had a backup one. We literally spell in front of my nieces so they don't know what we were saying. Yeah, the problem with that is that they will eventually figure out how to spell, and then all of a sudden they'll be like, oh, did you just say bed? You're like, oh crap, that doesn't work anymore. We're at that point. Yeah, my daughter can read and spell now, so we can no longer spell things in front of her. Okay, personal social behaviors. So this skills of independence is important. They have these sudden mood swings because of learning those independent skills. Remember, they don't have the ability to be independent yet. They're only toddlers, but they think they're independent. If you haven't heard the term three-nager, that's something that we sometimes say with these younger kids, because they think they're independent, they think they can do everything themselves, and they can't quite. So it does lead to those tyrannical, strong-willed behaviors, the temper tantrums, and literally sometimes they're trying to get themselves dressed and they can't get the shirt on, and then the next second they're in a mess on the floor in a temper tantrum. It's just because they're so frustrated at trying to learn that skill, and they think they can do it, and then they can't do it, and it leads to these temper tantrums. And it is, again, a normal thing for us to see temper tantrums in this age. Skills that they're learning: feeding, playing dress up, and I've got the picture there with the kids, dressed up as different careers. They love to play doctors and nurses and firefighters and those kind of things at this age. And learning that and playing pretend, playing dress up, those kind of things are helping develop some of those skills of dressing and undressing themselves. All right, concerns with growth and development. Toilet training. Remember I mentioned it too. Those myelin sheaths have now developed on the spinal column, and they can be toilet trained. Your book has like 2 pages on toilet training. I don't know why they think nursing students need that much information on it. This is what I want you to know. By 2, they can. Boys take longer than girls. It's not uncommon for boys to not have nighttime toilet training down until they're about 5. But usually you can start daytime toilet training first, so they'll stay dry during the day. It takes a little while longer before they kind of develop that ability to hold their urine overnight. Just a little easier for girls than boys. All right, the temper tantrum. So these are normal things that we want them to have temper tantrums. It's actually okay for them to have temper tantrums because it means they're learning about the world around them, but it's challenging. It is frustrating. As a healthcare provider, when you come in and you're trying to give a kid medicine and they throw a temper tantrum, or they won't eat because of the food's green today and they ate green stuff yesterday, but it's green today and they're throwing a temper tantrum. So general things to help with temper tantrums. If they are safe, they're in a safe environment, they're not harming somebody else, they're not harming themselves, the best bet is usually to ignore the behavior. Because if you give attention to the behavior and you're like, well, what is it? What do you need? And you feed into whatever the temper tantrum is, it gives positive reinforcement for that temper tantrum. And so the next time that they want their way or whatever's going on, they will throw a temper tantrum. So general rule of thumb is to ignore the temper tantrum. If you've never seen the poor mom or the dad in the grocery store with the kid that's throwing the temper tantrum over whatever it is, it is best to ignore it. So one of the things that I tell parents to do is to take the cart and slowly walk away. And eventually the kid will figure out, mom's not giving into this behavior, I have to catch back up. And I would do this with my daughter at that age. Like I would just like slowly start walking away, and eventually she'd pick her head up or stop crying and be like, wait, and then run screaming after me. This worked on the ski slopes. We had Aria out on the ski slopes when she was 2, and she would throw temper tantrums at times, and there would be times where she'd just flop down on the snow and just be like, I don't want to go, pick me up. And I'm like, hell no, I'm not picking you up on your skis. I'm on a snowboard, and it's pretty much impossible to carry a wiggling toddler in skis on a snowboard. So I would just eventually like start going away slowly, and she eventually would pick herself up and come after me. So it does work. It's just challenging. I remember last week I mentioned choices. That helps eliminate some of those temper tantrums as a healthcare provider if you give them a choice versus just giving them a yes/no answer. The negatives, that no answer, that is the favorite word of the 2-year-old. Again, go back to those choices. Give them choices, so no is not the right answer. And sometimes we just have to say no is not the right answer and either give them a discipline or a timeout, or just say we have to do what we have to do. And sometimes that means like holding them down to give them their medicine because you are the adult in that situation and they just have to do what needs to be done. In regression behavior, it's very common for kids to regress behaviors. So let's say they were toilet trained and all of a sudden they're having a period of stress or they're hospitalized and now they're not toilet trained. That's common. It happens in any age with our pediatric patients. So we want to give them some leeway with that and understand, give parents some reinforcement that usually once they're through the stressor, they'll go back to those normal behaviors. It's not a good time to start teaching things like toilet training when a kid's hospitalized and stressed out in the hospital. Because they're just so many things overwhelming them. It's not a good time to learn a new skill. It's also common for kids to regress a little bit with their physical behaviors when they have a cognitive growth spurt. So I mentioned that they have these physical growth spurts, but they also have cognitive growth spurts. So if they're learning a new skill, like they're trying to learn some new vocabulary and they're really focusing hard on it, sometimes they'll forget to like potty train for a couple days and they'll be fussy and irritable, and then a couple days later all of a sudden they've learned this new cognitive skill, they've got new words, and then they're back to being potty trained. So that's also something that we see with some of those kind of cognitive and physical behavioral things that kids go through at this age. All right, health, nutrition, they are picky eaters. It's normal for them to be picky eaters. They don't need very much when they're not growing, so they'll stop eating. They also cannot sit through a meal at this age. They just don't have the attention span to sit through a meal at this age. So they are often called picky eaters. And sometimes they'll like, they ate peas yesterday, but they don't like peas today because they're green. We don't want to use that word around them, because if we use that word around them, now they pick up on it and then they're like, well, I'm just a picky eater. I'm not going to eat that. I'm a picky eater. So we want to try to stay away from the terminology, even though we know that's a normal. They will graze. So with a healthcare provider, having snacks available at the bedside, having those kind of things ready to go is helpful. They will start drinking whole milk at 1 year of age. So they can now start taking whole milk instead of the breast milk or the formula, whole milk. If they're obese, we recommend 2% milk. If they're normal weight, then they can have regular cow's milk or whole milk because they need the fat for their brain development. They should not be drinking more than 24 to 30 ounces of milk a day. It's important at this age because if they're drinking too much milk, then they're not eating enough table foods, and we need those table foods for their vitamins and minerals and protein intake. They should also limit fruit to 1 cup a day. Fruit is usually sweet, so it's something kids will eat more of. We want them to also get more meats and veggies in, so limiting fruit to 1 cup a day. Vegetarian diets, other diets that kids sometimes follow because of family behaviors, are okay at this age. There's no reason they can't be a vegetarian, but we want to make sure that the family understands what a complex protein is, because they need all of those amino acids for growth, for proper growth. So as long as they're following that vegetarian diet, they're getting appropriate complex proteins, that's totally fine. Obese, if they're obese, they need 2% milk. If they're not obese, yep. Yeah, so obese kids, 2% milk. If they're not obese, whole milk. But we don't want to go all the way down to skim milk because they need the fat content still for brain development. Okay, and then generally we try not to use food as a reward system. You guys know when you finish a test and it's the end of the quarter, you all go out for drinks and dinner, right? Or something along those lines. I know you guys go over to Brothers or wherever it is around the block. That's the pick for the night. So it's a reward system for us as adults, right? We celebrate, we have these events where we go out. We should stay away from that. As a child, it sets them up for those behaviors, and some of the things that we've seen are this is linked to our increased obesity rates as adults because food is no longer for just keeping our bodies alive. It's now a reward, it's social activity, and we overeat. So we want to make sure that we're trying to not set them up for those behaviors when they're younger. There are some exceptions to this. If you guys remember getting like a lollipop or something like that when you went to the doctor's office and you got a shot, we do still use some of this as a reward system, but we want to try to stay away from that. Okay, sleep and activity. So sleep at this age for the toddlers, they should be getting up to 12 hours of sleep. So 11 to 12 hours of sleep a day. That can be broken up. If they are taking 2 naps, which is common for the 1-year-old to be taking 2 naps, then they should be getting 10 hours of sleep at night and then 2 1-hour naps. If they're only taking 1 1-hour nap, then they need that 11 hours at night. So 12 hours total minus whatever those naps are for the day. Now, most 1-year-olds are still taking 2 naps a day. The 3-year-olds may be taking 1 nap. Some 3-year-olds don't take any naps. So if they're not napping, they need 12 hours of sleep at night. And that can be hard for parents to make sure they're getting in for their child, that their child's getting that sleep. We see a lot of links with behavioral issues, decreased school performance, decreased cognitive performance, and decreased growth in kids that are not getting enough sleep. So it's really important for them to get sleep at this age. All right, dental health at this point, this is still the parent's responsibility at this age for the toddlers, but we want to encourage that independence. So we do that by giving the toddler the toothbrush and letting them brush their own teeth, right? They need follow-up with the parent. So sometimes it's the parent that does the full 2-minute brushing the teeth first and then gives them the toothbrush, or the toddler practices first with the toothbrush and then the parent follows up with a good 2-minute brushing. So we're giving them those skills just so that they can practice brushing their own teeth as they get older, but they still do not do a good job at it. They should now be seeing the dentist twice a year. By 3 years of age, usually that's when we're starting kind of the maybe some x-rays, maybe some teeth cleanings at that point, but usually in the toddler years, it's just a checkup still, making sure the teeth have all come in healthy, the gums look healthy, they don't have any cavities. Fluoride toothpaste, I mentioned we start at 2 years of age, and then we want to limit sugar in the diet, and they should never be put to sleep with a bottle or a cup of juice or something that has sugar in it. The bottle of milk, if it's a kid that needs that comfort and needs a bottle of milk before bed, they should not be put to bed with the bottle of milk. That sugar from milk will rot their teeth, and that's one of the links with those cavities that we talked about last week. So not putting them to bed with the bottle of milk. If they are a kid that needs that comfort before bed, the bottle, they need their teeth brushed before they're put down. And then they can have a cup of water or something like that for comfort if they need something to drink in their bed, but they shouldn't have anything else in there. All right, injury prevention, motor vehicle injuries, so car seat safety at this age. The Academy of Pediatrics recommends that children stay in their rear-facing car seat until they reach the max weight and height limit for that car seat. We used to have an age limit for this. It used to be 1, and then it was 2. And then we got rid of the age requirement altogether. And the reason for that is that we want kids to stay rear-facing for as long as possible, as long as possible. And that could be a 4-year-old, a 5-year-old, a 6-year-old that's still rear-facing as long as they are meeting that weight and height requirement for that rear-facing car seat. Some of the things that we get are things like, well, their legs are too long. They can't fit in the rear-facing car seat. They will. They will put their legs to the side. They'll put them up the seat. They'll cross them in front of them. And if it's the only thing that they've known, they don't know any better. They just learn to adapt. Rear-facing is the safest place for a child to be. In a forward-facing car seat, if they get into a car accident, they get this forward neck snap that happens, and that can literally decapitate their heads in a severe car accident. And as an ER nurse, I have actually seen this happen, a full decapitation from a car accident. So rear-facing is the safest place to be because that doesn't happen in that rear-facing seat. Yeah, it's a fairly shocking experience. So we want them rear-facing for as long as possible. Proper car seat safety is important. And they're car seat safety specialists that can check and make sure parents have it installed correctly. That's an important teaching point with parents. Drownings at this age, remember the toddlers are an increased risk factor because they're mobile now, so we should be supervising. We should make sure that bodies of water like swimming pools have fences around them. Can't you go to a firehouse and they can install a car seat? Yeah, a lot of firehouses do have safety specialists. Not all of them do it. Most of the children's hospitals will also do it, and you can make an appointment with a car seat safety specialist for free, and they will install the car seat and make sure it's installed. And most of the firehouses do as well. You just have to call ahead of time and make sure the person there that's kind of certified can do it. There are people that charge for that service. I don't think anybody should be paying for it because it's free service at a lot of different facilities around the metro area. Okay, burns. Yeah, police departments do it too. Yep. Burns with kids, we mentioned last week, the toddlers exploring and touching surfaces, those kind of things. So teaching about fire safety is important. Poisonings, 18 months is the peak age that we see poison control get called on because they're still exploring, they're really mobile, and they will put things into their mouth and all kinds of weird things, which we'll talk about a couple weeks from now. Or next week. Aspiration and suffocation is still a problem at this age, usually food related, but they're still putting toys or smaller objects in their mouth that they shouldn't be, and there's a risk for aspiration and suffocation. And then bodily damage. Falls at this age are now because they're mobile. The toddlers are just not great on their feet. Remember, they're top heavy, they got those big heads, big bellies, and they're top heavy, so they fall over. They just are a little more uncoordinated. They climb up onto things and fall off. The picture here, this is my daughter. She was about 2 in this picture. You can see the giant goose egg on her forehead there. My alma mater is Florida State University, and our alumni watching bar for football games is Brothers across the street from school. So we were over there watching a football game one afternoon, and she was on the couch on the outside patio area and rolled off of it and cracked her head on the concrete. The strongest part of your head is your forehead. So most kids hit their forehead because it's kind of the top heavy part, and it usually doesn't cause any issues, but it's definitely one of the areas that we see frequently with kids. They also are more likely to be struck by cars from just running out into the street because they don't have that sense of like look both ways before you cross the street. And then we see more things like bee stings and spider bites and those kind of things at this age because they will freak out if a bee's around them and then they get stung, versus an adult that'll just kind of walk away from the bee. So we see a lot of these injuries with kids at this age. Yeah, insurance agents also do the car seat checks. There's a lot of people that will do it for free, so you just have to look it up, and there's websites that you can look it up on too. Okay, family-centered care, page 377 to 378 for this chapter. Nurses discussing with a parent group the importance of fluoride for healthy teeth. Which of the following recommendations should be made? Fluorinated mouth rinses should be used in children older than 1. Brush teeth with fluorinated toothpaste unless the fluoride in the water supply is adequate. Give supplements to breastfed infants beginning at age 2 months, or determine whether the water supply is fluorinated. Do I have more than 10 people listening? All right, good job, guys. The right answer is D. So we want to determine whether the water supply is fluorinated. We do have populations that don't have city water. For example, like Denver, we have city water that's fluorinated. If they're in the mountains and they're on a well system, they do not have fluoride in the water supply. And so we may give fluoride for that reason. That helps protect their teeth from cavities. 2 months is way too young, so C is not the right answer. Brushing teeth with fluoride toothpaste unless the water supply is adequate. We recommend fluoride toothpaste regardless of whether they have fluorinated water or not. And then again, 1 for the mouth rinses is too young because they'll swallow it and that'll stain their teeth brown. Bottled water does not have fluoride in it. So if they're taking just bottled water only, then we may do fluoride supplements as well. All right, I'm going to give you guys another break. It is 10:51, so we will start back up at 11:01. All right, I'm back, guys. Everybody got their coffee and feeling more awake? Eh. You guys think this material is interesting or is it challenging? It's definitely a lot. I know it's a lot. I got a bang energy. Well, I guess if that gets you awake, whatever works for you. Reminds me of when my kids were that age. Yeah. Christina, yep, you're interested in it. Yeah, it's definitely challenging, especially if you don't have kids or worked with kids. I agree. And this is one area that takes more time. I put in my announcement that you guys should see here shortly after it gets sent out that this is definitely an area that it might take you a little more time to study as you're going through, especially if you don't have kids. So keep that in mind. All right, we got 2 more hours. You guys can do this. We'll get through this. Chapter 12 is the preschooler. So we're going to go through our preschooler. Your objectives. And your growth and development with this age. So 3 to 5-year-olds are preschoolers, and the big change that we see with our preschoolers are school. The school age kids are the end of this period, but this is when they're starting school by the end of this. So by 5, most kids are starting kindergarten. If they go to school before that, it's usually preschool years. Not every kid is required to do that. Colorado doesn't require kids to go to preschool, but they usually start in kindergarten by 5, some kids by 6. So usually around the end of this developmental period, they're starting school. They now can tolerate separations for a shorter amount of times and long school days. So that's why they can start kindergarten, especially by 5 years of age. They now have pretty good language skills. The 5-year-old has a very extensive vocabulary. They have several thousand words by that point. So they can talk and communicate in full sentences by this point, and they do talk a lot. They're now able to use mental symbolization. They're able to think about things in their head and really kind of make some of those critical thinking connections. And they have the attention span to sit through lessons like language lessons and math lessons and learning to write their name. There's research studies that look at kids' attention spans. One that I saw a few years ago was a group of kids that they put one kid at a time into a room, and they had different stations in the room. So they had like a doll house and a play kitchen and those kind of things in the room. And they did the different age groups. They did a 3-year-old, a 4-year-old, and a 5-year-old, and they looked how long they spent at each station. The 3-year-olds were all over the room. They didn't spend more than 5 minutes at an activity. The 4-year-olds could spend about 10 minutes at an activity, so they only bumped around a few times in that hour period. The 5-year-old, however, only spent about 15 to 20 minutes at each station, so they were only at a couple stations for that hour. So they really have enough attention span to sit still long enough to be able to listen to a teacher read a book or tell them a basic math story, those kind of things. Biologic development, they're still gaining weight pretty rapidly, about 5 pounds a year, and they're still growing height-wise pretty rapidly, about 2.5 to 3 inches a year still. So about the same pretty much as the toddler years. Their mature body systems are now tolerating stressors, and their kidneys are pretty mature. Their heart is starting to become more mature. They don't get as sick, but they still get a lot of colds and fevers and those kind of things. So they can tolerate minor stressors throughout this developmental stage. Erickson's development is initiative versus guilt. They like to initiate learning. They will come up to an adult and say, hey, I want to do that, or hey, I can do that, and they want to really learn. And this is the kid that is kind of that 3-year-old that's starting to ask more information about the world around them. They're trying to get these skills to learn more. And I've got the picture up here of the kid that's baking. So that's an activity that preschoolers love to do. They like to bake because it gives them something that they can make and see afterwards. If you've ever tried to bake with a 4-year-old, it is not an easy experience. They make a mess with things, and there's usually eggshells in the batter, and it doesn't always have the right amount of salt or sugar or whatever it is in it. but they love doing it. It's the final project that they love doing. So we want to try to help support them through that. So the adults can give them the positive reinforcement, try not to use negativity around it like we were talking about before, try not to over discipline them. It's normal for them to make a mess, right? It's a normal development thing for them to make a mess. It's normal for them to break eggshells in the bowl. If we have an adult that's criticizing them for that or disciplining them for making a mess, when they're doing something that it's acceptable for, then it puts them into that guilt phase. So we want to give them those opportunities to learn and also help support that learning. So if the cake doesn't come out well, whatever it is they're baking, or there's like eggshells in it, instead of criticizing for that and saying, okay, well, we did not do well, this was terrible, there's eggshells in it, you know, I'll do that part next time because you can't do that. That's criticizing them for that activity. So a better way would be to say, okay, there were eggshells in the batter this time, what can we do differently next time that can help get rid of that or help avoid that? And that helps develop those critical thinking skills. They may not be able to come up with the right answer initially, but they will start to learn, well, maybe we should do that separately and then we can get out the eggs or something like that. Would it hinder the development if you prepped all the ingredients beforehand into individual bowls to pour into the batter? No, at this age, that's actually okay. It does help give them some skills of like learning how to crack eggs or learning how to measure those kind of things. But especially for the 3-year-old, kind of starting with that and working your way up is a great way to address that. Yeah. How the heck can these kids cook gourmet meals on the chef shows? They get taught at an early age. I actually enjoy the fact that we've been home with Arya this week and I've been able to teach her how to cook. My dad's a chef, so I think I'm a pretty decent cook. So we've been doing like some basic stuff with our, baking and stuff. Yesterday we made a pepperoni mozzarella bread. So she helped measure out all the ingredients and got to mix everything together. And it's good at that age. And now she's in the school age years, so they can independently do a lot more things in these preschool years, but they have to be able to practice to get to that independent stage. Yeah. Okay, magical thinking is another concept. This is a psychosocial / cognitive skill. It's a big part of their development at this age. The definition of magical thinking is that thoughts are all powerful. They literally think that if they think about something happening, they will control it and make it happen. So let's say they get into a fight, like brother and sister get into a fight, and sister thinks about something bad happening to brother because she's mad at him. And then he goes out on his bike later in the day and he gets into a bike accident. She literally will think she caused that bike accident to happen because of that magical thinking. They really think that their thoughts can control everything around them. If they get in the hospital and they get an IV or something like that for something that is a normal part of hospitalization, they may think it's punishment for something that they did. So it's important for us to reinforce that with this magical thinking thought process, that they're not controlling that environment. It's just something that happened. Like we're having to do the IV just to get them better, not because it's punishment for something. Their super ego is starting to develop. That's the consciousness, like what is right and wrong. It's really starting at this point. I'm going to talk about a theorist that goes along with that in a second. Cognitive development is Piaget. Remember I mentioned that preconceptual phase of development for the 2 to 4-year-olds? This is part of the pre-operational phase. So that's the kind of overriding header that I want you to remember is pre-operational phase of development. So that includes preconceptual phase, the 2 to 4-year-olds, and then intuitive phase, the 4 to 7 years. So intuition, it's kind of the same thing with this cognitive development, that they're really starting to get engaged more and learn more and starting to make those basic processes of thought processes and connections. Egocentricity is still very, very evident in their thought process, but they're now starting to kind of have a social shift. Remember the toddlers, we wanted them to separate from that primary caregiver. They're now able to kind of really able to move forward with that concept. So in this phase, I'll give you an example of something my daughter would do at that like 3 to 4-year-old phase. She would come up to me and say something like, Mom, I want to go to the park. And I would look at her and be like, but Mommy doesn't want to go to the park. And she would look at me and kind of think about it a little bit more and be like, okay, well, what do you want to do? And I would say something else, whatever, I want to go on a walk. And she'd be like, but I still want to go to the park. So they're still very much in their own egocentric kind of mindset, but they're starting to understand that there's other people that have different thoughts and behaviors around them. Just starting that at this age. In terms of that cognitive development, the 5-year-old will be expected to do which of the following? Use magical thinking, think abstractly, understand conservation of matter, or comprehend another person's perspective. Yep, it's that magical thinking. Remember that magical thinking. Abstract thought processes do not come up until teenagers years. It's the adolescents that we see with abstract thought processes. Conservation of matter, if you don't understand or if you don't remember what that one is, this is like the concept of like if you had a ball of clay and you broke it up into 2 chunks and you flattened one out and you had one in a ball, the flat piece looks bigger, but it's still the same amount of material. So that's that mass matter kind of stuff, like middle school science class, if you think back to that kind of stuff. Comprehending another person's perspective happens in these school age years. Well, Kohlberg is another theorist that we haven't talked about yet. So this is moral development. So Kohlberg is moral development. This is the pre-moral level for our preschooler. So pre-moral, preschool. They are basic moral judgment at this point. They only understand right and wrong because of reward and punishment. They get a punishment because they hit somebody. They know that it's wrong because they'll get a punishment next time, not because of the underlying thought process behind it, like it hurts to get hit or we shouldn't do that to somebody else, only because they got a reward or a punishment. We do know that rewards work better for motivators for kids versus punishment all the time, that it's better to get a kid to change their behavior with reward systems. So keep that in mind with moral development. They're still doing things to satisfy their own needs. It's very still much that egocentricity, kind of doing things because they want to do them is how they kind of view the world around them. So another example of something my daughter did at this age, this was, I was gone on one of our GHP trips. My husband texted this story to me. They were in the car going somewhere and our dog was in the car. We have this fluffy chow mix dog. She threw something, my daughter threw something and it hit the dog. My husband said, hey, you gotta watch, you gotta be careful. And she says, sorry. And he's like, well, sometimes sorry is not enough. You have to be careful. And she sits there and she thinks about it and she's like, well, but when I want to do something, I just do it because that's what I want to do. That is the preschoolers. That is like doing things just because they want to do things. She knew she needed to say sorry, right? She said sorry. She threw something, but she didn't understand why she was saying sorry. She didn't understand the concept behind that. And that is our preschooler. The image and sexuality at this point, they now start to understand the desirable appearances. So again, going back to that, not using those descriptors like fat, skinny, those kind of things around kids, because they do start to pick up on that. They pick up the body image around the world based on what people are wearing around them, those kind of things. They do start to recognize racial identities at this age, especially towards the end of these years. They start to recognize different skin colors and that we have different backgrounds. Their biases will start coming out based on that and based on the world around them from the adults in their lives that are kind of giving them more information about the world around them. The story kind of goes along with that. My daughter, she knows that I travel a lot, especially for GHP. I've been to Uganda 5 times, so she knows the name. She's seen pictures and those kind of things. But it took her a little while to kind of get that concept. Like this racial identity is something that kids just don't recognize when they're younger. We were watching a movie called The Queen of Katwa, which is a Disney movie. It's about a little girl in Uganda who learns to play chess and goes on to play internationally. And I thought she was age appropriate to start watching this movie. And this was beginning of this year, like probably January, I want to say. So right before she turned 6, she was about 5. And we're watching it and she turns to me and she's like, Mom, everybody has dark skin. And she just had never had that concept in her head because we're so mixed in our identities in the United States. She's never seen that before. So she just was like, wait, I don't understand. So we had a conversation about that and how we do have these different skin colors in different parts of the world. So they're really just starting those concepts in these preschool years. They do have poorly defined body boundaries. Remember that magical thinking that I talked about? They will think that all of their insides leak out if they get a cut. So Band-Aids make everything better at this age. They do attach to the opposite sex parent usually at this age, but they identify with the same sex parent. So they're still doing kind of those like household mimicking, those kind of things with the same sex parent. But this is the age that we see like the little girl that wants to marry daddy. That's typically what we see kind of around this age. They do continue to touch their bodies and will start asking more questions now. And they may ask questions about reproduction at this age because they start to see babies and they start to see, kids that are younger from them. And they're like, well, where do they come from? This is the age that they really don't want to know the whole story. They don't need to know the whole story about sex yet. And going into it is usually way more detailed than they want to know. A great way to ask a kid that asks you maybe this question, or if you're having some of these discussions about it, is to ask them, well, where do you think babies come from? And then they'll give you an answer. And it may be something like the stork, because that's what mom said to them. And I can't tell you how many times I've had this question in the hospital, and I'll turn to the parents and like, well, what has your parent told you? Because you don't necessarily want to go against what the parent has said in the room with them. But usually saying something basic like babies come from mommy's tummies is usually all they want to hear at this age, and they'll go back to playing. Nope, the preschoolers are 3 to 5 year olds. So we're talking about the preschoolers still. Yep. Modesty is a concept at this age that they're starting to understand. They will have kind of understand that they need to go out and be dressed in public. Before that, remember, the toddler loves to be naked. They love being naked. They will strip down naked. They love being naked. This age, they kind of start to understand they need to be clothed a little bit more. My daughter would do things like she would come home from school and be like, Mom, are you coming over today? And I'd say no, and she'd be like, woo, clothes off. If I said yes, she'd be like, okay, all right, I'll stay dressed. So they start to understand that at this age. All right, play at this age is associative. We talked about that playing house earlier. This age, they will start to associate and play house together. Like one kid is playing the dad, one kid's playing the mom, or one kid's playing the baby, and they play together. They associate together. It's a group activity. So that's why kindergarten at this age, they can start to interact and do group activities and read together as a group and kind of learn from each other. A lot of what they're doing at this age is imaginative play. Things like playing dress up and pretending to be house and firefighters and those kind of things are all part of that imaginative activity. Another example of something kids do, like if they're in sports at this age, they don't quite have the concept of working together for a sport, for an end goal, like team play at this age. They will, if they're playing soccer, if you've never seen a soccer game with 3 and 4 year olds, it is great to watch. It's very entertaining. They have the ball, and there's a group of kids, and they've been put onto teams. They've got a green team and a blue team, and they've been put onto teams. But what they'll do at this age is they'll just all chase the ball around. They don't quite understand the concepts of the rules behind the game yet, and they look like little schools of fish just chasing the ball around. So that's associating with each other. They're doing the same activity, but not quite working towards an end goal. Toys at this age group, coloring books are great for any age. I mean, for us as adults, they're great. It's a good imaginative activity. Puzzles and blocks that are a little bit bigger. Legos are still too small for this age group, but they make like Duplo blocks that are bigger. Clay, like Play-Doh, dolls, boys and girls, and toys that let them learn about the hospital event. Like I talked about last week, the little doll where they could practice the tourniquet, and the little alcohol pad and those kind of things also help decrease that stress and anxiety. All right, normal growth and development with this age group. Preschool and kindergarten is the big thing here. So starting school is the big one that's a stressor for kids. Kindergarten can be a huge stressor for a kid that didn't go to preschool because it's a lot. They have to sit still, they have to follow in line, be quiet. So it can be a huge jump developmentally for them to go through. So the like August, September period could be a very turmoil period for kids. We do developmental screenings. I mentioned last week the ASQ, that Ages and Stages questionnaire that we do. That is one of the things that we do to help screen for developmental readiness for kids. We're looking at their developmental level, whether they fall into that normal category with their cognitive, their gross motor, their fine motor skills, whether they're ready for school. Because sometimes kids that are a younger 5-year-old and maybe not quite developmentally ready should wait another year before they start school, and they'll just do better with it. We teach infection control procedures in school with kids. They will just sneeze and cough into your face at this age. It's terrible. I can't tell you how many times I've been just like sneezed right in my face from kids at this age. So we teach those infection control measures like good hand washing and sneezing and cough etiquette. We teach basics first with the hand. So we show them how to put their hand in front of their mouth and their nose because that's an easier concept for them to understand. But then we still have all the germs on our hands, right? So then we slowly teach them the elbow and coughing and sneezing into the elbow, but they're still not great at it. My daughter she's been sick with a cough for the last couple weeks, and she would still like, here is where her arm would be like way out here. I'm like, well, that's not quite doing anything at this point. Um, so working on that so that it can help decrease the spread of infections. And then just like we talked about procedures in the hospital and prepping kids beforehand to decrease their anxiety, prepping them for school. So introducing them to the school, letting them see the kindergarten class, letting them meet their teacher ahead of time, which is why we usually have those kind of back to school nights so that they can meet the teacher to help decrease that stress. My daughter's school, her preschool, did like a shadow a kindergartner day so that they could sit in with the kindergartner before they started school to kind of get what that process was like. Okay, fears and stressors at this age. Fear being in the dark, fear being alone, fear of animals, fear of ghosts. You know, think back to being a kid and like the shadow across the wall looks like a person standing in your room. And this could be stuff that the kid was not afraid of the dark before, and all of a sudden they're now afraid of the dark because their imagination is starting to run amok and they are, you know, afraid of what they didn't used to be. That also includes us as nurses, because a lot of times at this age, every checkup that they've gotten a shot at the doctor's office, so they think that they're going to get a shot. That's us, right? So lots of stressors, lots of fears at this age. Ways that we can minimize those are important to think about, like we talked about with atraumatic care last week and putting a nightlight on the room, giving them their stuffy, those kind of things. Parents are great resources to help figure out what the signs of stress are for kids. So some kids like shut down and don't talk and they don't interact. Some kids are really interactive and they will start behaving and outbursting and not behaving well if they're having stress. So parents can kind of give us some resources to help deal with that. And we can do ways to reduce that stress by prepping them for procedures, giving them an explanation that's age appropriate. So think about, for yourself, if you're sleep deprived, you get a little bit more sensitive to things. Usually most of us are a little bit more sensitive if we're sleep deprived. And the same goes true for hunger, right? If we're not eating, we get a little bit more sensitive. So that concept of hangry, way more true for a preschooler. Everything is going to be more stressful for them. In the hospital, out of the hospital, you'll see more temper tantrums in a kid that's tired and hungry. So minimizing those kind of things, making sure they get enough sleep and they've got enough food to eat will help minimize those stressors, especially while they're in the hospital. All right, aggression. So it's normal for us to see aggression get worse around 4 years of age. So right about 4 years of age, they start to have more aggressive behaviors with others, biting others, those kind of things. And this is normal. It's a normal developmental thing. Just like temper tantrums are normal, they still need discipline around those aggressive behaviors, though. They still need a timeout or a punishment around that aggressive behavior. You don't want to just ignore it because then how do they learn it's right or wrong? It can be influenced by a lot of reasons, one of them being gender. Boys are just more aggressive than girls are, so we see that more frequently with boys. They also do it because of frustration, and this is really common at this age, especially when they're learning a new skill. Like, let's say they're trying to put together a puzzle or a block or whatever, and they can't do it, and they get frustrated and they throw it across the room, or they throw it at their friend sitting across from them, or they hate you as the adult. Not okay, but it's understandable while they're doing it. So they still need a punishment, but it's because of that frustration of them like figuring out and learning around them. Modeling is also something that can influence this. If they're seeing other kids do it, they may do it. Or if they're seeing it at home because they're getting abused at home, that may also be a reason of seeing a child being more aggressive and hitting kids around them. Reinforcement of this behavior. Positive reinforcement are the kids around them laughing because they threw something or they did something silly that was aggression. That's positive reinforcement. We don't want to see that because that encourages them to do more activities like that. The negative reinforcement would be giving them the timeout if they hit, so that way they learn not to do it anymore. This is something that we see normally at 4. It should decrease by 5 years of age. If it does not decrease by that age, then we want to kind of assess why. And that could be something like the abuse going on at home, or maybe some other stressors that are going on in that child's life that are creating these behaviors and these outbursts to happen. Nutrition at this age is 90 kilocalories per kilogram, so it depends on their size and their age. Food likes and dislikes are really common at this age, and its influence is around them. So they will eat the food that's being offered to them around them. So this holds true for our toddlers as well. This is something that I mentioned last week, that remember kids had their food likes and dislikes by the time they're about 3 years of age. So by the time we're hitting this, we're now kind of already in that point where they have those food likes and dislikes. And we talked about things like the chicken nuggets and the burgers and the french fries and those kind of things. So kids will eat the foods that are offered to them. If the norm is the fish and the broccoli, that is what they will eat. So general kind of guidance for parents on this one is most kids will not starve themselves to death. If they are hungry enough, they will eat what's put in front of them. So if the parents make something for dinner that the kid is saying, I don't like this, I don't want this, they're a picky eater, they just don't want to eat it, the parent's response can be, okay, well, this is what's for dinner and this is what you need to eat. And if you don't want to eat it, you don't have to, but you can go to bed hungry. And I will do things like, they can save the plate. If the food, is something they don't want to eat, but they're not going to waste it, they can save the plate and say, okay, well, if you get hungry in an hour, you can eat it. And some kids will do that. They'll hold out for an hour later, they're like starving, and then they'll eat what's put in front of them. Or they may not, and they'll go to bed hungry, and the next morning they'll be so hungry that they'll eat what's put in front of them. And that's how they learn this is the food choices. If they have mom or dad that's like, well, okay, we're trying, it's turned into a fight, the kid doesn't want to eat this, you still need to eat something, I'll just make you some mac and cheese. That positive reinforcement for that bad behavior, and that kid is going to learn that behavior. And so the next time they don't want to eat something put in front of them, they'll throw a temper tantrum or not eat it, and they know that mom or dad will make them the mac and cheese. My parents used to make me sit at the table until I ate all the food on my plate. Yeah, I mean, it works, and you'll eventually learn. Like, kids will eventually learn. That's how they learn these behaviors. My rule was always a no thank you bite. So when she was younger, it was, okay, well, this is what's for dinner. You have to at least take a no thank you bite. If you take a no thank you bite of like whatever the green beans or whatever it is, and finish the rest of your food, you're done for the night. So she at least had to try everything on her plate. And I mentioned last week, she likes broccoli and cauliflower and those kind of things. So that's how kids learn those food likes and dislikes. If they're not able to taste them and they're not encouraged to eat those foods, they don't learn to like them. And it's influenced by others around them. That's why kids in different countries learn to enjoy the foods around them, because it's influenced by their families around them. So we have to encourage those positive behaviors. Dental health at this point, the 5-year-old can independently brush their teeth now. They still need some adult supervision, but the 5-year-old has the mechanical ability to spend 2 minutes brushing their teeth twice a day, flossing twice a day. They just needed an adult to make sure that it's being done. The 3-year-old still needs a little bit of encouragement, and then they should still be doing twice a year dental visits. They now will get teeth cleanings at this age. They'll get their x-rays at this age, and just making sure that they have good oral hygiene. Sleep and activity at this age, they sleep 12 hours per night, and if not napping, they should be sleeping full 12 hours. If they're taking a nap during the day, then they can decrease that nighttime sleep a little bit. Kindergartners do not nap anymore. We don't give naps in kindergarten anymore. I know, it's sad, it sucks. They spend literally 8 hours learning at school now. Yeah, school is intense now. They don't take naps anymore, so no naps. Yeah, naps are great. My office is in my guest bedroom. If you can see the bed behind me, it's a tease all day. They come home completely worn out because they don't get these naps anymore. So it's really important that they get that 12 hours of sleep at night. So the parents have to set them up for those positive behaviors of sleeping and getting them to bed on time. Wouldn't that reduce their ability to learn and play? Yep, there's a lot of research that shows that it reduces their attention span, because you guys know as adults, it's really hard to sit here for an hour and then get these 10-minute breaks, right? That's as an adult, it sucks sitting for an hour, but kids, it's the same thing. We used to have naps in kindergarten. I had naps in kindergarten, the 80s, 90s, we had naps in kindergarten. They've gotten rid of it. What is my opinion on elementary schools adopting the 4-day school week? Good question, William. I think that there are some positives to it. It gives kids some free activities. My daughter's school does long full days. They go to school 8 to 4, Monday through Thursday, and then Fridays they only go to school till noon. So she gets a lot more playtime on Fridays, which I think is helpful for her, and she's still growing and learning. I think because of our financial situations in school settings, I think that's one way that they've kind of worked around that, and kids are still learning and growing. My biggest thing that I think is a downside to it is that kids don't get enough free activity. They just don't get this free play that I've got on the slide here. Our Denver school system only requires 30 minutes of PE a day. 30 minutes is all they require, is mandated in our elementary schools for kids to get. So we talk about things like the obesity problems and kids just not getting out and playing enough. They just aren't getting enough activity in school, and it does create some issues. It's been linked to things like the increase in ADHD. Kids are not meant to sit still for that long, so they're going to have those behaviors of ADHD because they're not getting that body movement time. Yeah. Jeff is doing the full 4 days a week, and you love. Well, for homeschooling, I would agree that is a plus. Yeah, that's definitely something that's interesting. State testing drives the schedule more than the behaviors of kids. Yes, Heather, the state testing does drive it, and unfortunately, we have poor state testing, so they think that the upside is that is like giving more education. But there are some states actually on the opposite where they've decreased their education. They've seen the test scores go up because they're giving kids more free time. PE was the jam in my elementary school. Yeah, PE is great. My daughter's school gives them outdoor recess and PE, but they only get it every other day. Yeah, so every elementary school is a little different of what they're doing. Her homeschooling, like their plan, they're doing PE videos for the kids to do. So we've done some like home yoga and some other like home PE videos at home for outdoor activity for kids. So some kids are doing okay with it, some aren't. If they're not getting enough activity in school, then they need more activity at home in the afternoon. So we need to encourage parents to say, okay, they need to come home and have 30 minutes of outdoor activity at home in the afternoons after school. And that helps get all those wiggles so that they can sit and focus on things. My 5th grader is doing her home PE right now. Awesome, nice. Love to hear that. I'm gonna keep kids active while they're at home. Because they're overwhelmed makes sense while there's an increase in anxiety. Absolutely, Dan. I agree that they're just not getting some of those coping skills, and we know that exercise is a coping skill for kids, so that's a great point. Okay, let's talk about a case study here. So doing a well child physical assessment, parents of a 4-year-old say that their child resists going to bed every night and cries until they allow them to go to bed with them. This has now become a nightly habit. What guidance should the nurse give to the parents? So think about all the things that we just talked about. What kind of things would you help tell this parent to help deal with this? Allow them to cry themselves to sleep and self-soothe. It's an important skill for kids to learn. I agree. Yep. Promote independence. Creating routine. Absolutely. That routine of saying, like, we do our teeth, we read a book, we go to bed, helps kids with that sense of security. Yep, the new bedtime routine. Absolutely. Leave the door open. So remember, one of the fears that we talked about was the fear of being alone. So sometimes just leaving the door open and reassuring, mom and dad are out here. You can come get us if you need something, but this is your space for sleeping. Security objects. Yep, create that kind of safe space for them. It's going to suck for a few nights, but you got to make them do it. Absolutely, yeah. Your sleep as a parent is going to decrease because the kid's getting up and up and up and up, and you have to keep saying, okay, we're going back to bed, we're going back to bed, we're going back to bed. Give them a teddy bear, so that sense of security. Absolutely, whatever that comfort item is. Identify why the child doesn't want to go to sleep. Yeah, fear the dark, could fix that with a nightlight. Absolutely. Figure out, is it fear of the dark? Is it fear of being alone? Is it fear of monsters? That's a really common one, is the monsters. So we do things like monster spray, and I use this in the hospital. I usually had I would have a spray bottle in my bag. Sometimes I use like the syringes. Monster spray, it's literally just water, but you tell the kid it's monster spray and it will protect them. It's got magical powers and it will protect them. So you spray it around the bed and you put a little bit on them and it protects them from the monsters at night, and it really does work. The other thing is like having their stuffed animal army and just putting all their stuffed animals around them and telling them that their stuffed animals will help protect them at night. Yep, plays into that magical thinking. Absolutely. Everything's creative at this point. My sister gave her daughter a flashlight if she needs to find her in the night, and it turns into a game. Yeah. Yep. So flashlight, something like that. Get those reassurances of figuring out what's going on. Both parents have to be on board with it. If we've got, a two parent household kind of situation, and one parent's like, well, but they're so sweet. I don't want to deal with it. And so like one night the one parent does it, puts them back in their bed. The next night the parent doesn't. It sets them up for failure because they aren't reinforcing that you got to go back to your own bed behaviors, and then they'll just keep doing it. So I'll share a story with you. Professor Borman knows that I share this, so MedSurge will. His daughter was doing this for quite some time with them. She would get into bed with them. And if you've ever seen a kid that's 3, 4, little kids that sleep, they don't sleep in the same position all night. Like if they lay down straight like this, by the end of the night, they're like upside down and their legs are kicking out. And they're like flailing throughout the night. They don't sleep in the same position. So he kept getting kicked and beat up on in the middle of the night. So he ended up sleeping in her toddler bed. So he would come to work the next morning and be like, Tara, I'm so tired. I was sleeping in the toddler bed last night. And I'm like, Will, what? No, let's talk about this. So I helped him figure out what kind of things were going on. And he was the one that she was wrapped around the little finger, so they worked on it, and he eventually got her back into her bed so he could sleep in his own bed. If you cover your toes, the monsters won't get you. Is that something that he said in class? Yeah. Yep, there you go. Yeah, we all remember that as a kid, right? Pulling the blanket up. It'll take your seat back. Oh, good times. I'm gonna have to ask him about that one. His parents used to threaten him with his sisters that they would use the blankets. That's funny. Yep. Good times. So this is a really common thing at this age. Parents have to set them up for those behaviors to figure it out so it doesn't become a routine habit. They can get their own sleep. Okay, injury prevention, safety education at this point, developing long-term safety behaviors. So the bike helmets, they're now old enough to start riding a bike. So they're wearing their helmets. We want them learning about stranger danger and crossing the street safely. They're now old enough to start manipulating the fire objects like lighters and matches in the stove. So we want to teach them about that safety items. And then car seat safety at this age. So we have a couple different versions, and I've got 2 pictures up on the slide here. This one here that I'm circling with the police officer is a 5-point harness. So this is a forward-facing 5-point harness car seat. Children should stay in this 5-point harness, forward-facing 5-point car seat until they reach the max height and weight requirement for that manufacturer. And they're all slightly different on what that is. My daughter is 6.5, 6 1/4, and she's still in a forward-facing 5-point harness because it's got the chest strap here and then it's got that crotch strap. Once they are big enough to transition out of this, then they need to be in a booster seat. And this top picture here, full-backed booster seat, sometimes you'll see just the bottom portion where it's just this bottom piece without the top part. The full-backed ones are safer because they do provide extra protection in a car accident. The way the booster seats work is that they raise up their little butts so that that adult car seat strap can come across their hips in the right position and across their chest in the right position so that it protects their internal organs and their airway if they get into a car accident. My daughter's just now big enough to fit a booster seat, but she's safer in the 5-point harness, which is why we still have her in the safe 5-point harness. But we went to Toronto to visit our family for Christmas this year, and we brought just the booster seat with us because she's just old enough. So for a vacation, it was a couple of days, it was okay, but the 5-point harness is still the best place for kids to be. Now the recommendations on booster seats, and every state is slightly different on this one. So they've actually just changed the requirements that they're now actually recommending that children stay in a booster seat until 12 years of age, until they hit adolescence. But the general guidelines on this one are that the children are at least 8 and 80 pounds or 4'9". So 80 pounds or 4'9". They need that bigger muscle mass, which is that 80 pounds, or they're at least 4'9". And sometimes I get, they're like, but I'm not even 4'9". you're at least 80 pounds. As an adult, you're going to be at least 80 pounds. Yep, 12. 12 is the safest for them to be in that booster seat cell because their little bodies are still growing and changing a lot. I joke that my daughter's not going to hit the 80 pounds before she's in high school, so she may be in that booster seat for a long time. She's going to be driving with the like books underneath her. Oh yeah, I'm going to get them, but mom, it's so uncool. And this is also safest place is backseat for kids, at least until 8 years of age, because those airbags are really intense when they deploy. So in the case of an accident, it can cause significant injury to a younger child. Yeah, my poor kid. I know. She's tiny. She only weighs 34 pounds, and she was up to 36, I think, and she's over 6, so she's really tiny. Yeah, I don't. Most 12-year-olds would not want to sit in a booster seat still. I agree. It is one of those things, like if it's the norm, it becomes the norm. Like bike helmets were not the norm in the 90s when we initiated it, and then we got a lot of kickback. Kids didn't want to wear it because it wasn't cool, and now kids are totally fine wearing bike helmets or snowboarding and those kind of things. So it just has to become the norm. Family Center Care is on page 391 for the preschool years, and then our school age kid. So I'm going to start this chapter and give you guys a break in a little bit longer here. Okay, objectives for this chapter. This is the 6 to 12-year-olds. So gradual growth and development is what we say this age group. They don't grow as much during this period until they hit the end of their school age years, when they're hitting prepubescence and they're starting to hit puberty. Then they start to grow a little bit more. Physical growth changes for this age group. Their height is only increasing 1 to 2 inches per year. So remember, we were doing 3 inches a year for those younger kids. Now they're only growing 1 to 2 inches per year and about 2 to 3 kilos. So they're still gaining about 5 to 6 pounds, and they do have a tendency to get a little extra fluffy, extra fat before the end of the developmental period here, because their body is kind of building that up before they hit that big puberty growth spurt. Males and females sorry guys, do differ a little bit in size at this age until prepubescence, and then the girls will hit puberty first, so they'll gain height first, and that's usually around 10 years of age that we'll start to see girls start to differ. But between that 6 to 10-year-old period, boys and girls are about the same height. They're usually about the same weight. They don't differ a lot at this age. Bladder capacity increases. They absolutely, by school age years, can hold their urine overnight. They should be potty trained at this point for nighttime and daytime. Their heart is smaller in relation to the rest of their body. It's now centrally located in the middle of their chest, and it's the same proportion sizes that we see with adults. Their immune system is now very effective. When they get a cold now, they don't usually get fevers anymore. They'll get the congestion, but they won't get the fever anymore. We do see an increase with things like strep throat and mycoplasma pneumonias in this age group, but not as many of the colds and coughs and other respiratory things. Their bones are increasing in ossification, but their ligaments are stronger than their bones at this age, so we see more fractures in this age group because they're a lot more active now, and their bones are still not strong enough to support some of those falls, so we see more fractures in this age group. And then physical maturity may happen before emotional maturity, especially towards the end of the school age years, when they're hitting those prepubescence, puberty years. They may look like adults or young adults, but they cognitively are not there yet. But prepubescence is defined as the 2 years preceding puberty, and this is usually between 9 to 12 years of age. So right at the end of the school age years, we want to look at family history for figuring that out. So when mom got her period, if it was 12, then around 10 is when we'll start to see these prepubescent signs with this child. And that's on average 10 for girls and 12 for boys, which is why I said the girls will start to gain height and mass before those boys do during this developmental stage. So psychosocial development, things to think about with relationships with this one. Sometimes kids at this age will play with the same sex. This is the age that we see the things of like, boys have cooties or girls have cooties. So girls usually play with girls, boys usually play with boys. And then until the end of this developmental stage. Freud described this as the latency period of psychosocial development because there's not a lot of interaction. Kids just play, they interact with each other. There's no like relationships that are really happening until the end of this developmental stage, when we start seeing that prepubescence start to kick in. Erickson with this one is industry versus inferiority. And I kind of compare this one to the Industrial Revolution in America, when we really started making things and accomplishing things with our factories, you know, things like car development in that developmental period. So kids really like to grow and develop, and this goes along with those attributes, sports, hobbies, those kind of things are what kids are really now starting to take hold of, and they're starting to become good at them now. They can be more independent with them, and they really like doing those kind of activities. Peer groups are still a strong motivator at this age. If the friends are into sports, or the friends are into cars, or the friends are into computers, whatever that is, that's usually what that child is kind of going to start to pick up on. But they start to pick up their own sense of independence of what they like to do and don't like to do. Everybody has a sense of inferiority when we're learning something new. You guys as nursing students do not feel comfortable in your skills as you're going out there, because you're still learning them, and that is okay. How we learn about those skills and how we get better at it is relying on our peers and our teachers and our educators and those around us to help us become competent, build that industry. So that's the same for kids. While they're learning these new skills, you know, they're not great at sports yet, they're not great at those hobbies yet, but they learn those skills from the adults around them and other friends around them as well. So if it's normal for them to have that inferiority, we want to help them move them past that to get to that industry development. If they have too many expectations placed on them, the kid that's like in a sport and they're in a music and they're in school that's like a college prep, and they have all of these expectations placed on them, they're not going to be able to develop that full sense of competency with the skills that they're learning. They just have too many things and they won't be able to accomplish all of them. I just have some examples here. We talked about baking as something with the preschoolers that they like to learn and do. Well, we're now moving towards these school age years, and kids can independently start doing this. We mentioned the cooking shows, right? The cooking shows. This is usually the school age kids that you're seeing on those cooking shows on TV that are good at it at this point, and they can do it independently. If they've been shown how to use the oven and the stove safely and correctly, they can do this independently at this age, but they have to have an adult to teach them those kind of skills. The computer is one that's really common with kids nowadays, doing programming and that kind of stuff. And I just put a picture in here. This was from Easter Sunday. My daughter and I, we've been baking a lot this week. We make cookies with unicorn chips on Sunday. So she did, you know, I told her how to measure it out. She dipped the flour in and the butter and all that stuff and made it herself. And you can see she's standing on a little step stool to get there and do that. But she's a school age kid, so they can start to independently learn those skills yet at this point. Cognitive development with Piaget. So this is concrete operations at this age. Concrete. Everything is still very black and white, and if you think about how hard concrete is, they're still very rigid in kind of their belief patterns at this point. They cannot think about the gray areas. They're very black and white with these things that they're learning. Thought processes, experiences, science, math, those kind of things. It's cause and effect. They understand conservation of matter now. They can really learn a lot of things at this point, but it still has to be like really hard, concrete thought processes still. They're no longer egocentric, so they already work really well as a team and kind of work as an end goal and take everybody's thoughts and feelings and emotions in a project. If you think about like science projects in elementary school, kids are good at it at this point, working together. Their judgments are now starting to be based on reasons, but their moral development is still kind of working towards full development. So Kohlberg with moral development. The 6 to 7 year old, the younger school age child, is still reward and punishment based, just like we just talked about with the preschool kids. So they do something bad, they get a punishment. The older school age child, that 10-year-old, 11-year-old, 12-year-old, now has an internal belief pattern. And this comes from the family belief pattern. This comes from parents' religious belief patterns, the things that they've learned from their parents and their teachers. That's how they are learning that. They now understand the concept that hitting is bad because it hurts and we shouldn't hurt someone, not because they got a timeout for it. That concept of treat others how you want to be treated, they now understand what that means now. social development with this one. So they are now starting to have more interactions with their peer group, and they enjoy spending more time with their peer group in this age group. Again, girls playing with girls, boys playing with boys. Not always, but that's a big part of it. It's a strong motivator for kids at this age, but they still want to spend more time with the family unit at this age. As they head towards puberty, that will start to change, but during this phase of development, they like spending more time with the family, but still need that peer involvement. As they move towards that middle childhood, we want to start giving them more independence with playing with their friends. So this age, parents starting to give them a little bit more freedom of like, okay, you can go to the park for an hour with your friends. For an older school age child, is helpful, giving them some of that independent play, helping them interact and learn about the world around them with other kids. Thinking about that, which of the following statements best describes the relationship school-age children have with their families? Children desire to spend equal time with family and peers. Children are prepared to reject parental controls. Children need and want restrictions placed on their behavior by the family. Or the peer group replaces the family as the primary influence in setting standards of behaviors and rules. C, children need and want restrictions placed on their behaviors by the family. So this is the age that we sometimes see kids get pulled into gangs. This is the age that we typically see them targeted, because kids really need that strong family unit to be their belief patterns. That's how they're learning about the world around them still. And so when they don't have that at home, they don't have that strong primary influence at home, they get targeted by leaders in gangs to pull them in and say, hey, I'm going to be that support. I'm your family, but do this for me. And that's how kids get pulled in, because they still really need that engagement and interaction at this age. So we still need those behaviors. D is adolescents. Yep, the peer group replacing the family as the primary influence is going to be our adolescents. And then B is also adolescents. The children prepared to reject parental controls is sometimes seen with the adolescents. There's not a developmental period where we have equal time with family and peers. It's either one or the other. Let's take a break here before we get into play. So I'm going to give you guys another 10 minutes. So it's 11:53, so we'll come back at 12:03. Last hour left, guys. Get up, do some stretches, get something to drink, snack. All right, guys, I'm back. Last hour, at least for me. I will make sure that this audio recording gets up on YouTube afterwards, but remember, you can always access the recordings at any time through Blackboard Collaborate to re-listen to them. You can download them. They do take a little while to download, which is why I've been kind of posted on YouTube last week, so you don't have to download if you don't want to. You can also play directly from the website for the recording, so keep that in mind. Please let me know if you have any questions or needs with anything, the assignments, that kind of stuff. And I'm more than happy to do phone calls too. YouTube is awesome. Yeah, okay, good to hear. Yeah, I'll keep doing that. I will say that next week's recording, I actually have the pre-recorded PowerPoint recording. If you haven't looked at the videos that I have on my YouTube channel, I have next week's chapter as a voiceover PowerPoint, which I think is a little bit of a better quality. You don't get some of the like class interactions, but it's a voiceover over the PowerPoint. I have that one for next week. So, all right, let's keep going here. So play at this age group is cooperative. They can cooperate with each other. They can now really understand how to work together as a group. So that soccer group that I was talking about, you know, the little schools of fish, they now have the two teams. They have the red team and the blue team, and they will work together as a team play to meet those end goals. So they're able to do that at this point. Do you guys remember what the last stage was called? What were the preschooler stage called? Everybody's still on break. Got one person. Yes, it is associative. The associative was the preschool group. Good. So school age, we're cooperative. We're team play, cooperative play. This is the age that we start to see all of the cliques and the clubs and the secret societies and those kind of things start to interact and start to pop up in schools. Kids are starting to learn those rules and rituals. Again, this goes back to that kind of like moral belief patterns. That kind of stuff is now part of their internal stuff now. So video games is one that we see commonly with kids at this age. So I want you guys to tell me, what do you think? Pluses and minuses of video games. Okay, depends on the game. They are violent. There can definitely be some violent ones. If you've ever played Grand Theft Auto, it is definitely not something that's appropriate for a school-age child. Not as active. Yep, they're sitting there. They're you know, just sitting there, right? But it does improve hand-eye coordination. Too much screen time. Better computer skills. Yeah, man, kids are great at computer skills at a young age. I saw a meme today, something like, I found her kid sitting and playing with the dog, and she's like, "Aren't you supposed to be in class?" And the kid was like, "Oh, no, don't worry about it, Mom. I took a screenshot of myself and posted it up there. The teacher has 20 kids. She's not going to notice." It was a 10-year-old. They're good at computers at this age. Interactive. They can be not social, but they can also be social activities. Kids at this age can use some of the online chat versions with the games online. You know, the PlayStations, the Game Boys, those kind of things have interactions where they can play against each other and online. It's a plus because it does help give kids interaction with other kids, but it's also a negative because there are adults in those situations that will take advantage of kids. Can be a stress reliever. It can be a pain reliever. Absolutely. We have video game systems in all the rooms in the hospital at Children's, and so it is a good stress reliever and a distractor for kids in that setting. And a lot of times those are kids that can't get up and move around a lot, so it is good for that. Some games work on team play. Absolutely. Yep. Problem solving. To catch my roommate archery with 12-year-olds a lot. Yep. My nieces FaceTimes her friends to play Minecraft together because of Corona. Yeah, so that, again, especially during this kind of like weird, different phase of life that we have, kids are interacting a lot more in computers than we normally are saying is okay. And there is a lot of research that shows that too much screen time is not good for brain development. So I think it's going to be interesting in a few years to see how this generation of kids that's being brought up on this digital platform are going to cope and develop. We don't know. VR can provide exercise. Yeah, the Wii also is another one that is still around and can provide exercise. My husband and I have had our Wii for a long time, and my daughter didn't know we had it. We pulled it out a couple weeks ago since we've all been at home, and we're like, okay, well, I guess the Wii might be something good because we have like the Wii bowling and the Wii sports and that kind of stuff. And I ended up buying a used Wii Dance Revolution or whatever on eBay that came in, and she loves it. So that's some of our PE sometimes is the Wii, and they get up and they move around. Yeah, kids are nuts. I ruin parties because I always get 300 and we bullet. Yeah, that's my husband. He can get perfect scores on that. I can't. My daughter's pretty good at it and she likes doing it. So there's a lot of pluses and there's a lot of negatives for video games. So kind of the key takeaways for this with the video games is limiting time for kids. If they are playing them, we should limit time, especially at this age with the younger school age population. The parents need to be very, very cautious about paying attention to what games they're playing and who they're interacting with online. It still needs a lot of parental supervision for them. And then, that time limiting so that they're getting out there interacting with other people outside. They're not just zoning out in front of the TV all the time. But yeah, there's good hand-eye coordination, problem-solving skills, those kind of things, as long as they're age appropriate. Good. All right. The team play, like I mentioned, is good at this age. Kids do really well with team play. They can interact. They're no longer egocentric, and it's good for them to develop those skills at this point. Other quiet games and activities for kids in the hospital or, while they're sick, those kind of things are the Legos are great at this age. They know how the dexterity to use Legos. Play-Doh is still great. Coloring is still great. Board games are great at this age. Journaling and book reading is also now a good thing at this age because they have the ability to do that. They can read starting at this age. Although our Denver statistics are about 50%, only about 50% of our school age population have reading competency before the age of 12 in the Denver metro area, which is a terrible statistic. Only 50% have reading competency. Ego tree has been developed at this age. Okay. Developing self-concept, that self-esteem is a really important concept at this age. We generally like ourselves less and less as we get older as kids. So we want to be able to develop that self-concept at this age to help kids move through this challenging developmental period, especially moving to adolescence when their bodies start to change and they have all of these emotions and feelings that start to come up, and how do they cope with those. So we want to start to help them develop this at this age, and that's from their parents and their teachers and their aunts and uncles and whoever are those positive adult role models in their life. And we also want to make sure that we're focusing on things like their abilities and their values and not just their appearance. If that kid is only hearing things like, aren't you cute, or you have pretty hair, or that dress is pretty, and that's the only thing they're hearing that gives them that positive self-worth, when they hit those teenage years and that body changes and they get acne and gangly and those kind of things, it's hard for them to cope and have a positive self-worth at that point. So we have to focus on those other things that they're good at. Body image and sexuality, again, they generally like themselves less as they get older. Their body image is influenced by peers. So an example of something my daughter is already exhibiting at this point, the differences are really highlighted. And if you think about like the first kid in your class in like 4th grade that got boobs, that kid was probably picked on, right? You pick on the kids that are different. So my daughter does zoo camp, and we did this like overnight zoo camp for New Year's where they stayed the night at the zoo, and it's great. It's only $60, so if you have kids that are school age, it is perfect. It's a whole night. So she goes to do this overnight zoo camp, and she loves zoo camp. She has a friend. We have a friend who bought her like one of the vests, like the zookeeper vests, right? So she has this on. She's so excited about it. We're walking towards the door for zoo camp, and she sees that nobody else is wearing it, and she wants to take it off, and she gets really uncomfortable, and she's like, Mom, I don't want to wear this. I'm like, why? You were so excited about it. And she's like, yeah, I just don't want to wear it. And she's starting to get really nervous and really uncomfortable. I'm like, it's okay. It's okay that nobody else is wearing it. You were really excited about it. Let's just keep it on for a little bit longer until we get into the room, then we can talk about it. And we get past the door, one of the counselors was like, oh man, I love your vest. And her behavior changed at that point. She was like, oh yeah, okay, all right, this is cool. All right, somebody acknowledged it. But she was still kind of uncomfortable about wearing it. And she did say that she took it off a little bit later in the night because nobody else had one on. that's as a 5-year-old, almost 6-year-old. They really start to pick up on these things at a young age, and kids start to pick on each other. So we have to encourage kids to not pay attention to those differences, that we all have differences, we all grow and change and like different things, and it's important to pick up on those kind of things at this age, especially heading into those adolescent years. Their sex roles will start to develop, like who they like or dislike in terms of wanting to have a relationship with as they get older. It's influenced by peers, it's also influenced by adults around them at this age, and we don't usually see that towards the end of their school age years. Along that line, education. It is normal for kids to be curious about this. Their bodies are growing and changing, they're touching their bodies more, and they're starting to hear other people talk about it. My allergies are nuts, sorry. Okay, so they need this sex education during this developmental period, and we generally say around 8 is a good age to start addressing this, just because that's when it's before their bodies will start to change, so they kind of get a little bit more information about those changes, and we give them that education before it starts to happen. Because if it's not happening from an adult, it's going to happen from somebody else. If you've ever seen South Park, some of the things that the kids talk about in there about what is sex and what are the different things that go along with that, they will come up with some really interesting things about what it actually is. So they need an adult that knows what it is to tell them. And generally at this age, we do the lifespan approach. And if you think back to middle school or elementary school, later elementary school, usually like 4th, 5th, 6th grade is when we see this. The boys will go into a separate room, the girls will go into a separate room, and we talk about our bodies changing. And so the girls go over periods and the boys go over things like facial hair and their voice changing and those kind of things. So that's kind of the start with that, and then it's typically high school that we start talking about like STD and scare them with the pictures and those kind of things. So we really need to be able to start encouraging that at this age. Now, not everybody is doing that. Emily said 5th grade flashback. So some of you guys may not have gotten one of these classes in school, and we are seeing this less and less and less in the school system, that they're actually doing this. Some of that's being influenced by parents speaking out and saying they don't want someone else to tell their child about sex. They want to be the ones doing it, which is okay, but the problem is that we don't have parents that are doing it, and we have parents that don't know how to do it. It's uncomfortable to talk to kids about sex, and it's uncomfortable to talk about it with your own kid. So, right, they're not doing a great job at it. So us as nurses, things that we can do to help with this. One, if you're a school nurse or working with a school, you can help encourage having these sessions. You can also help give parents those resources. There's videos, there's books out there that kind of help guide the conversation, so it helps give them a little more information. We also can be that role model in the healthcare setting. So if we have kids this age that come in to be seen, and we start asking those questions, it may not be the first time that the child opens up to us, but it may be the next time they come in that they start to ask those questions about what it is and how their bodies are changing or what their bodies are changing. I had to read a sex book with my dad. Uncomfortable for everyone involved. It is. It totally is uncomfortable for everyone involved, but it's really important for kids to get that information. My oldest got 2 lectures, one at 5th grade about body changes, and then one at 8th grade more sexual health. Exactly. And that's, again, that lifespan approach, right? We aren't seeing the 5th graders having sex. Really, that's the average is about 14. So it's really that 8th grade level that we're starting to see that. So we want to have them have that information beforehand. I'll share a video with you guys in an announcement after this about some parents that had the birds and the bees talk. It's pretty funny because some of the kids in the video are like, la, 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 I don't want to hear it, and some of them are like, oh yeah, it's this, and the dad in the video is like, oh, what? Where did you learn that? I also have had situations where I had a girl that came in, dad brought the kid in, it was a 10-year-old, she came in, and the chief complaint was bleeding down there. And usually I see that in the ER, it's from like falling on the bike bar, or they, were on a balance beam or something and they had some trauma and they ended up bleeding. So that was the chief complaint. And in triage, I went through all the questions. Nothing was coming up. And I was really confused as to what was going on. So we get the kid in the back, the doc goes in to see her, and after doing an assessment and everything, figured out it had just been her period that had gotten started. And 10's a little bit young, but it's definitely not abnormal. So we went and had a conversation about it, and the dad was like, but it's too young. This isn't, you know, this isn't the right age. And we're like, well, it is a little young, but it's okay. There was no mom in the picture. And so dad really didn't know how to deal with that. So I pulled the girl into a separate room, and we talked about periods, and we talked about tampons and pads and those kind of things. And we gave dad some more resources of how to deal with that, of having a young adult in his house and having a girl that was going through those changes. So not every parent even has those resources to be able to have those conversations. So as nurses, we can help provide that. And that's something, as an ER nurse, not a normal thing that we see on a regular basis, but it's something that as nurses we can help with, because you know, we learn about bodies and how they grow and change and that kind of stuff. So we have more education to help pass on. I had to talk with my daughter before they did it at school, so she would feel less uncomfortable at school when they talked about it in front of all their friends. And that's a great way to do it. Absolutely. Are there single parent support groups for situations like this that health facilities offer? I have heard of a few places that have done it. I've heard of schools that have done it before, like the school nurse of the school have done a few of those kind of things. Children's Hospital has a few resources that they give out. Like they give out these monthly newsletters. And I'll try to grab one to show you guys. I don't think I have one sitting at my desk handy. That go over some of these topics, and they do help give parents those resources, and they send them out by email and text and those kind of things that help. Good thoughts. Okay, other concerns with growth and development, school experiences. The school is a big socializing agent for peers. Remember, it's how they develop those peer relationships. It's how they kind of interact with the world around them. And they're usually spending a lot more time at school than they are at home at this age. Remember, they're spending Monday through Friday, 8 hours a day, which is more than like, you know, Saturday, Sunday at home with the parents. So it's a big socializing agent, positives and negatives with that. The teachers sometimes become these pseudo parents for kids because they identify with the teachers that they're spending so much time with, and that is okay. Sometimes parents get stressed out about that they're so attached to their teachers, but it is an okay thing for that to happen. Most kids will kind of move on past that as they get older. They let us pick out a book that they were using, so ask questions about openly. Okay, yeah, about the sex ed, yeah. So, you know, books, those kind of things, and there are a lot of them written for young adults. The American Girl brand that makes dolls has a whole book series for kids with that too. Okay, latchkey kids. So this is an older concept. If you're my age or younger, or older, you might know what this means. Basically, like kids in the 80s and 90s had keys, and at this age they would go home after school without parents at home because parents were working. That was socially acceptable at the time. It is not socially acceptable for kids to go home without parents now anymore at this age. So we see kind of the opposite that has happened. Instead of kids having this more independence as latchkey kids had, which was harmful sometimes because there was a lack of supervision, now we have the odd extreme where kids don't have that freedom to experience challenges and problem solving as independent. Some states have now have set out laws that mandate what is the oldest a child or the youngest a child can be home alone. And some states that's 12 to 14 years of age before they say a child is safe to be home alone by themselves. I don't know about you guys, but I know a lot of friends that were babysitting at 10 and 11 and 12 years of age. So we've kind of gone this opposite extreme in society with that. And we see things like helicopter parents, more the concept of snowplow parents that aren't giving their kids that freedom. And we have cases of CPS being called on parents that let their kids run around and play in their front yard without the parent being outside at this age. I let my kid ride her bike on the street in front of our house. She's been taught street safety. She's been taught how to ride her bike. And I'm comfortable that she'll come inside. I usually have the front door open, but I'm comfortable that she'll come inside if she needs something. Some of them is from the concept of like kids getting harmed more easily. There's more kidnappings happening. And statistically, it actually doesn't happen more frequently now than it used to. It's just that we hear about it more frequently. So there's more of this like fear factor in our faces of something happening to kids at that age that has contributed to some of those opposite behaviors that we're seeing. Yeah, the American Girl books are great. Okay, dishonest behavior, lying, stealing, cheating. This is a normal thing that kids do at this age. That's how they're learning those rules of right and wrong. So if you've ever played a board game with a kid that's like 7, they will steal and cheat. So they have to have those behaviors at all. That's how they learn right and wrong. So they need to, even though it's expected, we still need to give them those guidance about what is right and wrong. And then stressors and fears. What kind of can you think of? What kind of things do kids get stressed out about now? They're not so much worried about the fear of the dark or being alone anymore. What kind of things are stressed out now? School, homework, school age. The biggest thing is school. Appearance and being different. Absolutely. That is a huge one, especially moving into those adolescent years. Perfection. And we're seeing a lot more of that stress and anxiety of being like the perfect kid in terms of like school performance, that kind of stuff. Are their bodies normal? Yeah, I mentioned this one last week with your assessment as you're going through of what is a normal body change. Doing okay in school, peer acceptance, friends or lack of friends. Yep, absolutely. And I'll touch on that one a little bit with the adolescents a little bit more, but that's another one. Social media. Okay, I'll touch on social media since you brought it up. So we have a lot of research that shows that social media is harmful for children up until at least 16 years of age. There is a direct link between when our iPhones were put out into society in the early 2000s and increased risk of suicide. So some of what we see with the social media is that body image, that kids are seeing that. They see the different, like, what is the cool body image? And that goes back to like wearing clothes and that kind of stuff. When I was a kid, if we went to a slumber party, we wore whatever we wore. Our hair was however we were going to wear. If we took pictures, it was on a film and we had to develop it a week later, right? So it wasn't posted on social media. Now it's posted on social media instantly. So there's this constant thought process that goes into that of like, am I wearing the right clothes? Is my hair okay? Do I look okay? Is this the right appearance that I want to put out there? So that's another huge stressor for kids. The other thing that goes into that is the stressor of social media and exposure of kids, that fear of being left out. So they see, their friends that went to the movie theater yesterday or whatever, and that thought process goes into, well, why wasn't I invited to the movies yesterday? Why did I get left out? It may have nothing to do with that child. It may have just been the fact that the kids ran into each other and they decided to go to a movie. It could have, been a complete opposite, nothing to do with that. But there's that stressor that is another added piece with the social media. So we have a lot of research that shows that kids should not have smartphones and be exposed to those social media aspects of it. TikTok is huge right now because it was kind of popular beforehand, but now it's even bigger with like everybody being home and posting videos on it. There are a lot of harmful videos on TikTok. If you haven't delved into it, there are some on like anorexia and actually promoting anorexia. So kids get exposed to some adult things on social media as well. That's another huge stressor. Let's see, my 6-year-old niece worry about their hair and their clothes before leaving the house. Yeah, that's normal, unfortunately, at 6 years of age now because of what they're seeing around the world around them. And it is pretty normal for them to start developing those likes and dislikes at this age, but helping support a positive body image is important. That doesn't just focus on their clothing and their appearance. Okay, we talked about school. The one thing you guys did not touch on with school is school shootings. That is another huge stressor and fear with kids in America, and has been for several years now. I've seen full-on panic attacks with kids at this age from school shootings, or the stress of thinking about a school shooting, especially when they happen in society. We've had several in Colorado. We had one in Highlands Ranch last fall, and it has become such a norm for kids that they're just like, oh yeah, there was another school shooting. Like it's just the norm now. It's literally just the norm now. They do drills in schools for school shootings. My daughter's preschool last year, they started doing drills and they locked themselves in the bathroom and pretend there's a bad guy in the building. And they learn what to do, how to deal with that. There's body armor backpacks for kids now because it's such a problem. March was the first time in several years that we haven't had a school shooting in America. College, high school, school age group, because schools were closed. That's how much of a significant problem it's become. So teaching kids resources around that, they do, the children that have been through school shootings, like the kids down in Highlands Ranch were actually pretty spoken about it. The STEM school that was down there, they said that the drills they actually wanted to do because it felt like it helped them prepare for when it actually happened. They felt prepared for what happened. So it's an important part of education now, unfortunately, but it's a huge stressor for kids. Okay, I think you guys touched on most of the things. School is still one of the biggest things, and stuff around school is still one of the biggest things. School and friends. Nutrition at this age, 85 kilocalories per kilogram per day, so it's decreased from that prior stage because they're not growing as much. Until they hit puberty, they don't need to grow and eat as much. Still family patterns of eating. We see more fast food concerns at this age because kids are involved in more sports and after school activities, so it's more common for parents to not have time to make healthy meals at home. Reinforcing positive behaviors, fast food's okay every now and then to help support that. And then this is the age that kids a lot of times will start making their own school choices. You guys remember like the taco bar versus the salad bar, like pizza for the day, whatever it was. They still have the pizzas with the tiny little mini pepperonis on them in school. I think those things are indestructible, but everybody likes them, right? So kids will start making their own choices now. So we want to help set up those positive behaviors at home around eating so that they're more likely to make healthy habits at school. Sleep and rest. So the average at this age is 9.5 hours. This is the textbook answer on this one, 9.5 hours for your school age group. It depends on whether they're early school age or late school age. If they're in puberty, they need more sleep because that's when they grow. So it depends on whether they're in puberty or not. And it's individualized for each kid. Some kids do okay with 8 hours of sleep. Some kids need 10 hours of sleep during this phase. The signs that the child may not be getting enough sleep are things like problems in school, falling asleep in school, behavioral issues are all signs that the child may not be getting enough sleep for what their body needs. Minimum should never be less than 8 hours of sleep. Just like we recommend for adults, it should not be less than that normal 8 hours that we say for adults. So if I gave you a test question on that, it may be something like, which one would be a concern? So that would be like an excessive amount of sleep or a really, really small amount of sleep. They do sometimes resist going to bed around that 8 to 11-year-old period because they're not growing very much at that time, so they don't feel sleepy, so they don't need to sleep as much. And then around 12 or so when they're hitting puberty, then they're generally less resistant with bedtime because they're tired, because they're growing. As they kind of finish off puberty, then they're up late and don't sleep as much. Okay, exercise and activity at this age. Controversial whether they do competitive sports or not, or highly competitive sports, but sports are really good for kids at this age. It encourages teamwork, it encourages that ego mastery, it encourages them to build up their body skills. And kids that are in sports are less likely to have behavioral problems outside of school and get involved in things like drugs as they get older. Kids are sometimes in sports that are very, very physically demanding, and too much so on their little bodies that are growing. I was a competitive swimmer as a kid, and we did like some running and some push-ups and sit-ups and those kind of things outside of the swimming stuff. But now kids that are doing competitive swimming lift weights, and so it's a lot of activity on their younger bodies that may not be able to handle it. So we want to make sure that they have somebody that's monitoring their growth and development and being safe about those sports. Resilience, what are your thoughts on participation trophies? Oh man, yeah, that's a tough question. My personal belief on this one is that kids need to learn disappointment. Kids need to learn how to develop and deal with disappointment. So I think that there are some negatives around everybody getting a participation ribbon. As a swimmer myself, we got participation ribbons, but you knew you didn't get a trophy or first place, second place, those kind of things so it wasn't necessarily not around when I was a kid, but yeah, if you didn't do well, you didn't get a trophy. So I think there are some negatives around that. My personal belief on that. Dental health. You guys saw my kid, right? So she lost her front teeth. She's lost 3 of her bottom teeth at this point. They lose their baby teeth in the school age years and they get their permanent teeth. So now it's even more important for the dental teeth teachings and reinforcing brushing their teeth twice a day, flossing, and going to the dentist at least twice a year for those teeth cleanings to protect those adult teeth. They do have problems now if their teeth fall out. So let's say they fall and trip and they knock one of their teeth out. If it's a baby tooth, that big of a deal, that we know that they're going to get an adult tooth eventually. If it's a permanent tooth, it has to be corrected. And this is a nursing skill that we do. I've had to do it in the ER before. I think if you're working as an ER nurse or a clinic nurse or a school nurse, this is something you might do. But a general med surg nurse, I don't see any reason why you would do this on a regular basis. Maybe if a kid tripped in the hallway. If the tooth is intact, it has to be replaced. So you can see in the picture here, we've got this missing tooth that's been jammed up, that's fallen out, and you can see that the root is intact on that tooth. Basically, you've got that socket there, you push the tooth back up into the socket. It does hurt for the child, it's uncomfortable. It will make kind of a squishy, sucky sound as it goes in. Non-chartable term, squishy, sucky sound, as it goes in, and it will stay in place. It'll be a little wobbly until it heals, but it will stay in place. The tooth does need to be kept healthy until you can get back in, and that's either with a cup of milk or a cup of spit. It does not have to be the kid's own spit. It can be the parent's spit. If the tooth is chipped or broken or other teeth around it are chipped or broken, then they do need to see a dentist. But otherwise, this is something that we do as nurses. I know it's kind of gross. School health. So everybody that's involved with school health, the school nurses are involved with screenings. They're also involved with education in the schools, like those sex ed classes. There are a lot of times the school nurse that's in charge of giving those or coordinating them. They're in charge of making sure that all of the medications are up to date, that the child's records are up to date, that they have, their albuterol order is up to date for the school, and making sure that everybody in the healthcare setting has the education to keep kids safe. And sometimes that includes giving teachers updates on what asthma protocols are, so that if a teacher has a kid that is an asthmatic, they know what to do, how to address that while they're in school. Injury prevention at this age, motor vehicle accidents. This is an age that we see increases in the motor vehicle versus pedestrian. So the kids are on their bikes and skateboards and those kind of things more now. So they're usually a pedestrian that gets hit by the car. So we want to make sure that we continue to teach those safeties. Firearms, now they're old enough to manipulate them. We talked about that last week, keeping them safe around that. Smoking and drug use education should be started at this age. We do know that kids that have been taught some of those preventative things beforehand are less likely to use as teenagers. If you remember DARE when you were a kid, that's still around. I don't think they use it as much anymore, but it is something that we still see. Hobbies, safety around hobbies. And I've got a picture with the kid on their snowboard here. Helmet safety. The other thing that we encourage are wrist guards at this age, because they do break their wrist more frequently. So just proper safety equipment and car seat safety like we talked about before. And then family center care is 445. And our adolescents. Last 30 minutes, guys. All right, your objectives for this chapter. Growth and development. So this is considered the transitional period between childhood and adulthood, and this is typically defined as 12 to 19, sometimes 18 in some textbooks. Basically, what we consider it is the end of their puberty growth, so their physical fusing of their bones when they've finished growing. Now, for boys, that is sometimes 2021. But typically what you'll see defined as adolescence is just that 12 to 18 or 19-year-old period. We do also know that brain development continues until about 25 years of age. So this is more so our physical growth that we kind of defined as the end of adolescence. And this is a very rapid growth period, physical, cognitive, social, and emotional maturation that happens during this period. The definitions, I said that prepubescence was the 2 years preceding puberty. Puberty is related to those hormones, and then post-pubescence is the 1 to 3 years after puberty where hormones stabilize and full growth has occurred. And I just put the definition of adolescence up there, the time of growing into psychological, social, and physical maturation. So quick overview of hormones that are responsible for puberty. Estrogen is the feminizing hormone, and both sexes have this in low production until puberty. Males will have gradual increase, and then it'll stabilize throughout the rest of their adult lives. Females have a very rapid spike of this during puberty, and they increase about 3 years after menarche. So about 3 years after they get their period, it'll increase, and then it'll stabilize throughout their adult lives until they hit menopause. For the androgens, which are the male, the testosterone kind of hormones, those masculizing hormones, again, both sexes have this in lower quantities up until about 7 to 9 years of age. And then both sexes have a rapid increase of this. And the testosterone increase is one of the main things that triggers puberty in both boys and girls. And for girls, it is a level that kind of goes up and down during the cycles. For boys, it is a steady level that will stay at a steady kind of pace throughout their adult lives. It really doesn't drop off for a lot of men until they're hitting later adult years. Sometimes not as much until like 80s or 90s. So for females, it'll drop off more significantly with menopause. Okay, biologic development, those primary sex characteristics are the ones that are responsible for reproduction. So internal and external responsible for reproduction. The secondary ones are the ones that are part of puberty and part of reproduction, but you don't have to have them, like breast development, voice changes, those kind of things. The Tanner stages of sexual development. Dr. Tanner is the one that defined this, and you might remember talking about this in health assessment, at least touching on this. So I'm going to talk about the stages here. So there are 3 main stages that we see with females. The first one is the arc, and that is between 8 to 13 years of age. This is breast bud development. So this is when the girls start to develop their breasts. Adrenarche is the next phase, and they get pubic hair and they get the underarm hair. And then menses is about 2 years after thearche. So about 2 years after that first phase of development, they get their period. So puberty delay for females is considered that first phase. By 13, they still have not had that first phase of development. Or they hit the first phase of development, they hit the arc, they had some breast bud development, but 4 years later, they still have not had a period. That's also considered delayed puberty. The boys, they're named numbers, and I don't have 2 and 4 on here because it is just kind of filler in between these other stages. So stage 1 for boys is 9.5 to 14 years of age. Remember, it takes them a little bit longer to hit puberty. And their first thing is testicular enlargement and a little bit of pubic hair, usually kind of around the base of the penis. Then they will hit stage 2, which is a little bit more pubic hair. Stage 3 is penile enlargement. This is when their voice starts to crack and change. And then we also see gynecomastia, or breast development in boys during this phase, where they get, because of that estrogen kind of increasing, it's not uncommon for them to get some breast development. It will go away. Usually it takes about a year or 2 for it to go away, but it is a normal thing that we see with boys. And then stage 5, which is puberty for boys, is going to be full penile growth and their first ejaculation. And this is when their voice stabilizes. They have facial hair that'll start to grow at this point. So delayed puberty for boys is by 14, they haven't hit their first phase of development, or 4 years later, after that first phase, they have not had their first ejaculation. So girls is 13, boys is 14, or first stage, and then 4 years later. Is it true that evolution and free radical exposures cause girls to have periods much sooner? There are a lot of things that go into that, Ashley. Some of the things that we do know are some of the hormone exposures with our food sources have also contributed to that. So the average age of periods for girls has decreased. It used to be closer to 12 to 13, and now it's closer to 11 to 12. So there are a lot of things that do go into that. Yeah, good question. All right, physical growth. This is a dramatic period of growth. Kids gain about 25% of their overall height during the 1 to 2 years of puberty. So they sleep and they eat and they sleep and they eat and they grow. Huge growth increases. Their physiologic changes now, they have a lot more muscle mass, their vital signs and their labs reach adult levels. I do expect you to know adult levels for this class. That includes things like ABGs. I will not test you on the differences with some of the like neonate versus infant lab values, but there are differences. I do expect you to know those adult levels though. And they have good increased performance capabilities at this point. Cognitive development, Piaget, is formal operations. So this is when they can abstract think. They can think in future tense. They can think about all of those multiple variables. Critical thinking skills are really good at this point. They are concerned about others' thoughts and needs. Now, I say that they're thinking beyond the present, they're able to do critical thinking, they're able to think abstractly. Teenagers do not always, because they're risk takers and they don't always want to think about those kind of things. But the key with this one with cognitive development is they can think about those kind of things. They can think about what they want to be as adults moving forward and those kind of things in their life. With Kohlberg, moral development, they now have an internal set of moral patterns based on the family's belief patterns, but now they start to question those. Things like religion in the family. They will start to question whether they believe in God or the same God or whatever it is that that family has kind of taught them, those behaviors. One of the other things that we start to see in Colorado are things like the use that we see with marijuana use specifically, because it is a legal substance in the state. Teenagers start to question, why do parents get to do it and I don't? We have a lot of research that shows that it actually can cause a significant IQ decrease in teenagers while their brain is developing. So there are a lot of reasons why we don't want teenagers to use it. parents will actually encourage this sometimes, where they're actually giving it to their children because they see it as a safer alternative to alcohol. So those are some of the things that we see with this moral belief pattern. Teenagers will start to question what those family values have been placed on them now. Okay, Erickson's development is identity versus role confusion. They are developing their own self-identity at this point, who they want to be as adults, who are they going to be as adults. And sometimes that changes multiple times between their 12 to 18, 19-year-old development. Sometimes it literally changes day to day. You don't always know. They really have to have this group identity. I've got here this group identity versus alienation. They have to have that group identity to be able to develop their own self-identity. They have to have at least somebody else to identify with, to be able to recognize what they like and don't like. They experiment with that. That includes clothing, and I know sometimes in like mental health we talk about, is their clothing choice appropriate for the setting? Teenagers don't always have appropriate for the setting because they're experimenting with their clothing choices sometimes. And they experiment with the different groups that they like, you know, those different cliques and clubs and those kind of things. They're sometimes moving around a lot with that. Their sex role does start to identify at this point who they like, if it's boys, girls, both, whatever it is. They do start to pick up on those things now through those adolescent years. And that concept of emotionality is a big one with teenagers. All of those hormones going up and down when they hit this phase, they are like the toddlers again, where they're trying to express their independence, and they have all of these feelings and emotions that come up, and the hormones make them feel happy and sad and down and all these kind of things all at once. And that plays into these experimentations and roles that they're developing. Identity, the groups, like I said, the social hierarchy, you guys remember that from high school, right? The different cliques and socialization aspects of it. What we have found is that kids don't have to have a social group to be able to develop that self-identity, but they do need at least one best friend to have that kind of connection with the world around them. And we have found that this has been a big factor in teenagers that are also suicidal, is if they have that one person that's kind of that best friend they can identify with and talk to, it helps give them more ability to cope with those stressors of the world around them. And I've just got here, this is the transitional world between dependence on the parents and the autonomy and being an individual person. Their sex roles, again, identify at this point. Their sexual orientation identifies at this point. They experiment with sexual experimentation just like they do with their self-identity, those kind of things. As an ER nurse, I have seen a really wide range of what this looks like. And they are not always safe about their experimentation. So our role sometimes as a sex educator or as a nurse in these kind of settings is to help them, give them more guidance about what is safe while they're experimenting and being curious about it and learning about it. And that is a lot of times with things like safety about preventing some of those permanent things like a pregnancy or an STD like AIDS that you can't get rid of, helping prevent some of those kind of things. But also with things like experimentation that can harm them longer. We had a string of kids that were doing masturbation with suffocation at the same time, and we had a couple kids die. So the kids do those kind of experimentations kind of things at this age. Safety and helping give them that education is an important role as a nurse now. Okay, body image, again, that early adolescent period when their bodies start to change, they have blemishes and their body is really awkward. The first thing that starts to change on kids' faces is their nose. They get these like bigger noses, and then the rest of their body and face fills in from there. So they look kind of awkward for a little while. That self-concept that developed in those school age years, if they have a good self-concept from there, that will move into those adolescent years and really help them transition through this awkward phase when their body is kind of growing and changing. Social environments with parents, the roles start to change. They're now getting some of that independence, and we want the parents to start giving them that independence. The parents really need to start being able to give and trust the child to have more separation. As long as the child is showing they can be trusted. It is very important that the parent is still the authoritarian figure in their life, that they still are setting those rules. They have to be that person that is setting those rules in their life. The parent that tries to be the best friend, it does not work out well for the development period with this child. I've got the one thing there, emancipation from the parents may begin with the rejection of the parents by the teenager. When we see things like the parent that's not giving the child some of those independent freedoms and trusting that they can start developing some of that independence, we will start to see some of that separation happen in the teenager that's just like, well, if you, I'm going to do what I want to do. So we have to start seeing that mutual kind of agreement, but still have the parent as that figure that's setting the rules and behaviors. Other socializing stuff. School is a big socializer still for kids at this point. Work is now becoming more of a socializer for kids at this age. Usually when I do a survey of the class with this one, I get like maybe one or two that didn't have a job as a teenager. Most of us work as teenagers, and it's usually things like waitresses and sales clerks and those kind of things. It can be harmful for a teenager if it's more than 20 hours a week, but generally it's an okay thing. But kids get exposed to adult behaviors because they're working around adults. I worked in a lot of restaurants. You're working around a lot of adults, and you learn things from the adults that you're working with. So it is a socializing aspect. And then other interests, I've got leisure activities. We still want kids to be active and involved in leisure activities at this age. So I talked about the internet and social media and the risks with that and some of those negative downsides. Bullying, I think, is actually something that we didn't talk about. That's another big aspect, is the bullying problems that we see with school age and adolescents now. And it's anonymous. There's apps on the phones that they can start bullying each other with on the internet, and it creates more long-term kind of impacts with kids. It used to be that kids that were getting bullied at school could go home in the afternoons and weekends and they would have some separation from it, but now they get things like text messages and their social media accounts are hacked and that kind of thing. And so it's this constant bombardment of bullying that can have more of an impact. The one other thing I didn't mention with the work, if they're working too much, I do sometimes have families that are homeless, that the teenager is the one that's trying to pick up the bills because they have a job and working as a waitress or whatever it is, and that is harmful for child development. We do want them to have that free time and that ability to be a kid, so we want to help address that and give them some of those social assistances that might be needed for that population. All right, optimum health, we've got hormones, right? We've got normal hormones that through the body, and they have that emotionality that I mentioned, helping them cope with those hormones. We don't want to get rid of the hormones. It's an important part of development, but we want to help give them the coping measures to help deal with all of that. You know, the stressors that we talked about with the school age child are still there. All of that stuff that we just talked about was still there. Now we add things like boyfriends. What do I want to be as an adult? Do I want to go to college? Those added stressors increase the stress levels with teenagers. So how do we address it? How do we give them coping skills? So we have to give them these resources to help them deal with this. And we have found that over the last 10 years or so, our teenage population and our young college population actually have decreased coping abilities, and more stressors placed on them, more anxiety and more stressors placed on them by society in general. So we have to think about those kind of things. So journaling is great, taking a bubble bath is great, not drinking a whole bottle of wine, but you know, a little bit here and there. Socializing with friends is a great stress reliever. Exercise is a great stress reliever. So we want to help give them those resources and figure out what helps them deal with their stress. Drug use is something that we see increase in this population. 70% of 12th graders report alcohol use. Remember last week I mentioned that 10 to 12% have substance abuse problems. This is just the group that said that they tried it, you know, at a high school party. 50% use cannabis, and that's our population in the United States. That's not Colorado. The statistic is much higher in the state of Colorado on kids that have tried pot. And depression and suicide. I mentioned that Colorado is the #1 to #2 state for suicides in the country, and especially with an age population, it's a huge problem. So we really want to make sure that we're trying to think about those things that impact it: bullying, stress reduction, anxiety, and help reduce that to help impact our teenage population. Injury prevention at this age. Motor vehicle crashes are the single greatest cause of serious injury and fatal injuries with teenagers, especially from unintentional injury. It's related to things like drinking and driving, or driving too fast, driving without a seatbelt on are big factors with that. Other vehicles are things like the snowmobiles or four-wheelers, those kind of things we see an increased risk of. The firearms I mentioned were the #3 cause of death, the homicide with the teenagers. Sports injuries are a problem. Water safety with like diving into a shallow pool of water that they shouldn't have dived into and causing like a neck injury, that kind of stuff. Driving in under the influence increases risk. And then poisonings, which are usually accidental at this point. They took drugs at a party and they didn't know what was in the drug and they poisoned themselves. Tobacco, alcohol, those kind of things. We've seen things like early 2000s, we had a strain of kids that were doing things like alcohol enemas, where they were giving themselves enemas with literally vodka. So they weren't ingesting it, it absorbed faster, but there's a huge risk for alcohol poisoning with that. We also see things like pill parties where teenagers try to get pills they can find at the house, and sometimes that's narcotics, sometimes that's other drugs that they can find, and they take them without knowing what's in them. So again, huge risk for overdoses and mixing medications and those kind of things that shouldn't be mixed together. Safety is a big part with teaching kids prevention because they will do those experimentation things at this age. We want to help give them the resources to help prevent harming themselves long-term, permanent stuff. Nutrition at this age. Calories depends on the sex and the age. So females need less than males do, and it depends on whether they're in puberty or out of puberty or not, on how much they're going to need. Once we hit those adult ranges or they're through puberty, then it's the general recommendations that we say of like that 2,000 to 2,500 calories a day. Fad diets and body image issues start to come up more at this point. We start to see things like anorexia and bulimia pop up more with our teenagers. They do need more calcium during puberty because they're growing. Calcium, vitamin D, those kind of things. And this is the age that we really have to encourage those lifelong eating behaviors, because if they are obese and not eating healthy at this age, it continues into adulthood. The last thing here, guys, exercise and activity at this age, we have the same requirements that we recommend for adults. That's a minimum of 1 hour a day, 3 days a week, or 30 minutes a day. Sleep and rest, minimum is 8 hours. There is research that shows during puberty they need 14 hours of sleep. Most of them do not get that amount, but that's kind of where what their bodies need when they are going through puberty. Dental health should be all the same stuff as the school age kids. They now sometimes get their wisdom teeth in at this age, so we may have to address that. And then personal other stuff, vision and hearing screens should be done regularly. The hearing stuff, what we see an increased risk of is hearing loss. I was a kid that spent way too much time at concerts as a teenager, and I actually have hearing loss from it. So we want to encourage them to use things like earplugs when they're at concerts. And I think a lot of concert venues are pretty good about that now, handing those out at the door. And I see more kids using them now than used to. Posture stuff. I guarantee you guys are all sitting at your computer or you're on your couch or whatever, and you've kind of got the slumped over shoulders. You've got that postural kyphosis happening. That's really good with kids. We also see them on their phones like this, and then like head down on their phones. That also creates a lot of issue. We actually have something called texting thumb. That's a diagnosable disorder. It's kind of like tennis elbow. Posture corrector on. Good. If you guys don't know what she's talking about one of these. I have one as well. As a doctoral student that spends 16 hours a day on my computer, I have one as well. Yeah, I'm on my standing desk now. If you guys can't tell that I changed position, I'm standing up at the moment. It helps. Okay, body art, piercings, tattoos, those kind of things. Really being safe about it. They're socially acceptable nowadays. Even in nursing, it's pretty socially acceptable for us to have tattoos and piercings in the open and exposed. We just want to help give them some guidance about safety and preventing infections and like contractable diseases from unsafe, unclean needles, and then also maybe choices on what you want as an 18-year-old may not be what you want as a 30-year-old. Is also guidance that adults can help with teenagers at that age. Okay, 2 more slides, guys. Guidance page 464 for this chapter. So adolescents, unless previously immunized, should receive 3 doses of what vaccine? FA, MMR, HPV, or DPT? HPV is the one we give in the teenage years, yes. And then with Piaget, adolescent cognitive development is represented by the stage of formal operational thought, which includes which of the following? So select all apply. So these are yes or no. So believing that thoughts are all powerful. Is that a yes or no? No, correct. What age is that? what is it called? 5 is a good answer. Okay, preschool. Yep, preschool. It's preschool. And magical thinking. Yep, good. Magical thinking. So preschoolers, magical thinking. Thoughts are all powerful. So can the teenager think in abstract terms? Yes. Can they use future time perspective? Yes. And are they thinking in the here and now? Now remember, this is cognitive formal thought. The answer is no on this. Yep. So remember, in terms of like a textbook answer, cognitive development, formal operations, thinking in the here and now is the school-age child and younger. The formal operations means that they can think future time perspective. So remember that with teenagers. Risk-taking behavior, but they can think in future tense. Awesome, guys. Okay. Don't forget, you've got assignments due before class. Your quiz again will be on Thursdays at 2 o'clock. I haven't heard from anybody that anybody had some connection issues. It seemed like everybody got on right at time and was able to access it fairly easily. I will be on for office hours next week. I'll send out the link for that, and I'll be on for office hours. So if you have questions about the quiz or general stuff with studying, that kind of stuff, let me know, and I can address those during office hours. I may come up with a different process for answering test questions, those kind of things, because I feel like I spent way too much time on email yesterday with that kind of stuff. It's easier to address as like a whole class with those kind of things. So I may change how I address the test taking stuff next week. But please reach out to me if you have questions, or maybe you didn't do as well as you want to. I put some tips on my announcement for today on how to study and kind of what tools to study for, especially with these developmental stage stuff, because there's a lot of information in these chapters for you to study for the next quiz. You might have to spend a little more time. So, all right, guys, I will stay on again like I did last week if you have any questions before the end, but feel free to pop off, and I will see you guys next week. Have a good weekend.